accordance with Executive Order N29-20, the Humboldt County Board of Supervisors meetings are being held virtually. You can participate via the Zoom call-in number, which is on the screen and on the agenda by pressing *9 on your keypad to raise your hand, but more about that later. So, welcome to our third meeting of this year, and would you all please stand and follow me in the Pledge of Allegiance. There's multiple flags. Oh, with fireworks, okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. That part still seems really weird on video. All right, so we will now get moving on our agenda. I think at this time I will go to our CAO to see if there's any modifications to the agenda.
Good morning, Chair Bass. Yes, there's one modification to the agenda, and Supervisor Madrone is pulling item C8 for discussion.
All right. Is there a motion to approve consent calendar minus item C8?
I move to approve minus C8.
I second.
All right. There's been a motion and a second. I did want to let the folks who might be on the call, in fact, I have to see, I'm still learning how to do this myself. Ryan, how many people, do we have anyone on the call yet?
Yeah, Chair Bass, we do. We have 2 people with their hands raised up, and we currently have six attendees
Okay, good.
participating in the meeting.
I'm having a hard time seeing who's got their hands up, so I'd ask if you, I will figure this out. So before we do go to public comment, for those of you who would like to make comment, please raise your hand by pressing *9 at the beginning of the item you're interested in. And when we call your phone number, you will be unmuted and you'll have 3 minutes to make your comments. It's a hard 3 minutes. At 2.5 minutes, you'll hear a tone that will tell you it's time to start wrapping up. And at 3 minutes, the microphone will be turned off. Don't take it personally, because this is so everyone can have the very same opportunity to speak with the supervisors. So having gone through that, I will now go. I think I found the hands, Ryan. Oh boy, yay. Our first commenter is going to be last 4 digits of 7454, and welcome, Kent.
Good morning, Virginia. I did wish to make a comment on multiple items here. Item number 13, McKinney rezone reclassification. This is happening in Fortuna's planning area. It's an area that may be annexed. I think it's anticipated to be annexed, and yet my information from Fortuna, they weren't even notified of this particular topic. This should be pulled, and you get feedback from the people that should have feedback, and they should have been notified. So we're going to go on up here. I'm going from the bottom up. Number 12, we're reclassifying some sheriff's department people there, and these are the top 8 people there. My understanding is they are to each get approximately $6,750 more. The public should be aware of that per person. In my opinion, they could have been, other alternatives could have been done. We had the money there for it, apparently. The money is at discretion of the sheriff, but I really would like to see, rather than just all of them getting this money, some kind of incentive package, whether it be for overtime they work or for other kind of incentive. I always like to see that within the county. Now we're moving upward to item number 8. My understanding is that 8 may have some vendor that possibly is getting prepaid on a weekly basis.
That item's been pulled, Kent. So
that's been pulled. Excuse me. I appreciate you correcting me. I won't waste my time then. We have number 6, which is a planning commissioner at large position, which will be coming vacant. I strongly recommend those of you out there get on the list and consider if you're willing to do the job and pay the time to be on our planning commission. And boy, I think that pretty well covers them. We pulled C8, and so I will deal with that one a little bit later. I did, we do have some other things to deal with. I guess we'll deal with those during other topics of the meeting. Thank you for my opportunity to speak.
All right, thank you, Kent. Our next speaker is last 4 of 3053. I believe that might be Thomas.
Good morning, Thomas Mulder here. First off, I'm going to say thank you for the new time restraints. The ding, I think, is a good idea, as well as muting the microphone. I appreciate that. Item number 15, I believe, it's the Mattole Valley or Mattole something, the cannabis project. I missed 90% of your last meeting, but I clicked on when I was hearing the Board of Supervisors deliberate. I did not hear any testimony. Full disclosure, Paul Gallegos is my attorney. I have not spoke to anyone about this, but I heard the supervisors splitting hairs over like 700 square feet, trying to figure out what was pre-existing. I'd like to remind you that no questions asked with the small farmer ordinance, you did allow 2,000 square feet of new cultivation in a residence. So maybe it might be smart or a good idea to pull that item and add that to be 2,000 square feet of additional shaded grow. I'll tell you, I don't know the history of the previous cultivators, but I know when I was brought up into this world, you had 3 to 5 gardens, and you would have your bread and butter garden that was your most secluded. You would have your meat and potatoes, slang term, for another garden that was your next. You would have retirement gardens, which was, you know, you're a little more out in the open. You would have another garden for your attorney and another garden for vacation, which you might be a little more flagrant with or out in the open. So those are just things to consider. I can tell you that if people really did do those type of cultivation activities, you aren't going to see it from the air and the neighbors aren't going to see it. That's how people got away with it. Just something to consider. It was just interesting hearing everyone split hairs over like 700 to like 1,500 square feet when that small farmer ordinance was there for 2,000 square feet of new. I originally only supported existing. The other thing was, I think it's 18 and 19 or something like that. It's the bids for public works. So I hope those bids went out to a fair practice. I will remind you, in Bimbo area, there was 2 large storm damage repairs. And I don't know if the other contractors bidding on that were aware that Public Works was allowing people to run heavy loads and deteriorate the road surface. When you can put an extra 3 to 5 tons in every single load of moving spoils off of a slide, it cuts down on trucking time. So something to think about the fair practice. Thank you for the opportunity to speak.
Great, thank you, Thomas. And our last speaker on consent calendar is last 4 digits of, wait a minute, I think they just disappeared. Brian, are you saying, oh, then, sorry, I found it. I'm having a hard time with Zoom today. Last speaker is public number 6699. Welcome, and just press star 6 to unmute yourself. Well, we're going to go on, since this person is not on yet. Let's go to public number, had another call in of last 4 of 8910. Welcome.
Good morning, board. This is Brian Mitchell, and it's a pleasure to speak to you this morning. I just wanted to pop on because I've received several emails and calls and texts. Because the way it was noticed, a lot of people have presumed that I've resigned from the Planning Commission. And I just wanted to state for the record that I'm very interested and eager, if the board is willing to reappoint me, to continue serving. Thank you for my opportunity to speak.
All right. Thank you very much, Brian. So for one last time, we're going to go back to phone number ending in 6699. If you're on the line, please do press star 6 to unmute.
Can you hear me now? This is Roland Richmond.
Yes, Roland, thank you. Go ahead.
Okay, I just want to say that I'm representing the Humboldt State University's Emeritus Retired Faculty and Staff Association concerning a letter that we sent to the supervisors about the access to COVID vaccines.
Roland,
I'd like to thank...
Roland, pardon me, Roland.
Yes.
Interrupt. That's actually going to be a little bit further. I'd say that might go under our COVID update, and that'll be coming to us in just a little bit. Okay?
Okay, so you'll let me know when you're ready for me to speak?
You bet. Just stay on the line. Raise your hand. All right.
you.
Thanks, Roland. All right. So this is the last one that we have, and I'm going to close this part off. And it is a person with the last four numbers of 0920. Please welcome and press *6 so we can hear you.
Can you hear me?
Yes, thank you.
Yeah, this is a very simple question. I don't know how to access the visual part of the Zoom. The agenda doesn't say. It just gives the instructions for calling in like this.
Alrighty, we'll answer that after the public comment. This is actually on items on the consent calendar, but I will ask Ryan to help clear that up when we're finished with this item, okay?
Thank you.
You're welcome. All right, I do not see anyone else, so we will return to the board. And we do have a motion. We have a second. Is there any comment from the board on any items? All right, seeing none. Ryan, Rex, was that, were you waving, Rex?
Oh.
No, sorry. All right then, Ryan.
Hi.
Coming to us remotely, I know. Ryan, maybe we have a roll call vote, please.
Yes, Chair Bass. Supervisor Wilson?
Yes.
Supervisor Bushnell?
Yes.
Supervisor Bass?
Yes.
Supervisor Madrone?
Yes.
Supervisor Bohn?
10-4.
Thank you. Passes 5-0.
All right, thank you. And Ryan, before we move on, can you please explain to the person who called in how they can view this at the same time or the process for that?
Yes. So on the front page of the agenda, you can access the stream of the live meeting by going to humboldt.legistar.com. There will be the meeting date, January 26, 2021. There will be a link there that says in progress. Click that link and it will pop up the video feed of the meeting.
All right, thank you. And then we do want to remind people that if they are on the video watching it, that when you are able to speak to us, you turn the feed off or just turn it down, Ryan, or turn the volume down, off.
You just did.
You are correct. Once you are calling in and you're asking to be unmuted, you'd want to mute your feed so you don't get that echo in your background.
All right. Thank you, Ryan, for helping with that. I didn't want to give any wrong information. So at this point, we're going to go to public comment on agenda items that are not on our agenda. And the board will not take any action at this time, but it is your opportunity to talk about something that is not on the agenda. All right, we have one hand so far, and that would be welcome, Thomas, 3053.
Good morning, Thomas Mulder again. I emailed all of you wonderful pictures of the most blighted piece of property in Garberville, I believe. Under code enforcement and all those other aspects, I think this property would be prime example of the acquisition and cleanup. I know the county has done a lot of other abatement processes throughout the county, but I think this would be a good one to under public safety to go after. Also, when you're talking about abatements, there's state water board and all these other environmental things that we need to pay attention to. I mentioned the construction project in Bimbo earlier. Well, right now, before this winter storm happens, there's going to be a bunch of mud that's going to wash right into the drainage that's going to go right into the East Branch of the Eel River. Also, there's a bunch of stockpiles from over a year ago along Bryceland Road that the water was failed. When these rains hit, that sediment's going to go right into Redwood Creek, and I believe that's a salmon spawning tributary as well. So if the county is trying to get us to follow the rules, and me, myself, I try to talk to people about doing things the right way, I think those are bad examples that we're leaving out there. It's, don't do as I do, do as I say kind of things from the outside perspective looking in. So I think we need to try to work together with the community and the county to clean those kind of things up so those kind of behaviors aren't happening. Also, Bimbo Drive, that construction project, they ran heavy loads down deteriorated Bimbo Drive. They ran a sheep's foot compactor. With anyone's aware, a sheep's foot compactor is not meant to drive on the roads, as well as other equipment that is not permitted to drive on the roadways. I've emailed back and forth with Public Works. They say it's the engineering department. I want to know if that road isn't resurfaced and that walking path that my family had enjoyed, now has all these cobble ankle rollers in it. Who's liable? Do we have to go after the contractor personally as landowners? Do we have to go after Public Works, or do we go after the county for not holding contractors to the same standards? Thank you for the opportunity to speak.
Great, thank you very much, Thomas. Uh-oh, I have a short in you may not hear the bell. It looks like there's an equipment failure here. Our next and only speaker right now under public comment is Kent. Welcome.
Virginia, yeah, it's always a pleasure speaking after Mr. Mulder. I do know what that particular tool would have done to the road, and I don't know who is liable for that, but hopefully someone will fix that up. Thomas has got a sharp eye on those things. So ditto what Thomas said. You know, I get tired of this ongoing war, and I'm hoping it's going away, between the CAO's office and the auditor controller. I sat through a full special meeting on a Monday, two other meetings that was addressed, probably 12 hours of time regarding an investigation into the AC. And I know it's like Supervisor Bass, the chair, mentioned, you know, it may have been perceived to be a different agenda there. I think the thing's been fixed, but for this to just all drop off the thing due to the passage of time, and I guess I'm going to use that from now on as far as a reason for anything that happens in the county. It's just good or bad. I guess it's all due to the passage of time. I do also wish to comment, you know, when people communicate with other people within the county, there seems to be a major breakdown. Some people have alleged, I've been told, to be communicating or attempting to communicate with voicemail boxes that are not open. Anybody from any office, including the CAO's office, can walk down with a piece of paper and hand it to the auditor controller. I understand, not herself, but her staff's there. So there's no excuse for any lack of communication between anybody there. And I get tired of this. Somebody didn't return my call, or somebody didn't return an email. But there's always ways to follow up on this. And I'm good at it, as some of you know. I also wish to make comment regarding that article. There was a statement, and it's a troll thing, I think, with Jesse Austin in that article regarding the auditor controllers thing I was just referring to. It says, county tough guy, Rex Bohn, or Bohn backs down like a little, I won't say the word. Who can blame him? He doesn't want the accounting made public, revealing the cannabis fees are being used to grow his family cannabis. So Rex, you're always saying that it's just my perception that this is ongoing, but it seems to be out there on a continual basis. And I always take everything trolls say with a grain of salt. I don't do it myself, but I do kind of get a tenor both sides of a topic. And that's why I do take the time to read those comments. Thank you for the opportunity to speak on this today.
All right, thank you. And that was our last speaker under this item. So with that, we'll go back to the board, and we're going to move on to our special presentation. And today we do have an update on COVID-19. And I would like to welcome our public health team. There you guys are on the other page. Dr. Hoffman and Michelle Stevens and Sheriff Hansel. The floor is yours.
Thank you, Chairwoman Bass. Thank you, supervisors, and everyone for being here today. So, lots to update on since our last meeting. I'm going to take it in two sections today. Start with epidemiology and an update on where we're at with the disease in our community, and then we'll talk about vaccines. We also have Ryan Derby here today, who's going to talk about a mass vaccination effort that's under planning right now. So, as we know, we've been seeing increasing trends in our community for the last month and a half with COVID-19. The trends continue to stay strong, and we see continued disease spread among the community. We remain purple, and the trends look like we will remain purple for the coming weeks. We hope that there could be a downward trend in the future, like the rest of the state. We're not seeing that here right now. Yesterday, the state lifted regional stay-at-home orders for the rest of California, the ones that we never entered here in Northern California. And they changed the projections on how you would enter and exit the regional stay-at-home orders. It used to be a point in time that you would enter those, and now it's a projection instead of that point in time. And that's going to be updated on the CDPH website so that people can track that, and we're going to continue to put that projection on our website, on our dashboard. We've been seeing many outbreaks across all sectors of Humboldt County. These outbreaks are almost always associated with gatherings, and we've seen outbreaks in multiple places of employment. We've seen them in churches. We're starting to see more cases in schools, although we do not have any school outbreaks, but it has affected schools' operations and that many classrooms have to go on quarantine. I just want to take the time to remind everyone that any gathering indoors is risky at this time. There is a lot of COVID-19 in our community. There's been a lot of talk at the state level as well about changes in guidance to opening schools and how to do it safely. There's push for more testing, and we are actively working with the schools on how they can meet this guidance and do more testing and open safely and quickly. On the vaccine front, we continue to see changes from both the federal and state level on the vaccine program. There are many challenges. The supply is variable and very limited. We continue to only get 1,000 to 2,000 new first doses a week for our county. And despite the promises that we would get more, we will not be getting any more for the foreseeable future until changes to the supply chain and manufacturing that have been promised by the new administration come to fruition.
Hey, Doc, when you say 1,000 to 2,000 first doses, that means we're getting enough second doses to cover the second doses. That's not total vaccine. So we're getting about 3,000 a week then, or 2,500?
3,000 to 4,000 a week, depending on the week, yes.
So we're able to cover, okay. It's confusing that when you say it that way. So we do 1 to 2. Are we able to put out 2,000 a week yet?
Absolutely.
Okay. All right.
So, and thanks for bringing that. So now we are giving second doses. So we are giving double that amount. So each week it's gotten bigger and bigger. And now we're at the point where we really built the capacity to do more than they're sending us each week. This is now the point where we have many of the vaccinators asking for more vaccine than we can give them. So we built this ship as big as we can, and now we don't have enough to fill it. This is going on statewide. This is not a problem localized here to Humboldt County. We're hearing that there could be changes coming from the state in the whole vaccine plan and program. We have just updated our plan and we'll be submitting it to the board and putting it on the website. The update to our plan that was written originally back in November was updated at the beginning of January. And I just updated again this weekend of where we're at in terms of who we're vaccinating, where they're getting vaccinated, and how. The effort appears to be moving towards a mass vaccination attempt and away from the original plan that we would all be vaccinated in our doctor's offices. We were told at this point we would be getting more vaccination sites. Now we're being told less. So we're shifting. We're making it work. The community partners are coming together, and they are getting everyone vaccinated as quickly as possible.
Dr. Hoffman, I'm sorry to interrupt you there, but I'm gonna pull a Supervisor Bohn here for just a second. I think it's really interesting what you say about the sites being limited. And whenever you're done after this conversation, if you can talk about why it is that way, because it's hard enough for me to understand, and other people in the community might be going, why are they being limited? So I'm just saying, can you like cover that at some point in time? I think it's important for people to understand that they just can't be given everywhere. So.
Absolutely. So I'll wrap it up. The last thing I just wanted to let everyone know is about the interest form that was put on the website. We've had already over 7,500 entries on that interest form. We will begin to invite 75 and older from that interest form in the coming weeks, and as we develop clinics for those and work with our partners to get those folks vaccinated who don't have access through their doctor. It is a challenging time for sure. We are all working extraordinarily hard to get this vaccine out. Everyone in this community is working together. They're working very well. And I think that we will continue to have to change and pivot, and hopefully in the coming future, we'll have a solid, stable plan that won't change from week to week. And we can just move forward with that. So I want to leave some time for Ryan to present on the mass vaccination site. But before I do that, I'll go to Virginia's question about why are we limited? So we were originally, the vaccine was rolled out in the hospitals and then after that into large clinic settings. And the plan after that was to approve a lot of pharmacies and smaller providers in the community. The vaccine is difficult to handle. It has a lot of requirements for documentation and storage and handling. And so the state CDPH had decided that it was best to roll it out slowly in that way. But they seem to have changed their mind and now are not planning to roll it out any farther past new providers. So we are being told that we will likely be limited in the number of providers of the vaccine in our community. That's a challenge. That makes it harder. But we will do our best and we will get it out there. We will continue to use the partners who are vaccinating now, and we will work towards a mass vaccination plan that will continue to get the vaccine out. And hopefully we will get more vaccine once some of the Defense Production Act changes in syringes goes into play in the coming months.
All right, thank you. And I do see Supervisor Bushnell has her hands up. Would you be okay waiting till after Ryan gives his comments? Supervisor Bushnell?
I'm okay with that, but my specific questions are to Dr. Hoffman.
Okay, so
let's turn it over to Ryan, I guess, and then I'll take questions afterwards.
Okay, thank you. For those of you that don't know me, my name is Ryan Derby. I'm the Emergency Manager for the Sheriff's Office of Emergency Services. And for the past 10, 11 months, I've been assigned to the COVID-19 pandemic, working as the EOC Director. So as Dr. Hoffman alluded to, our biggest challenge right now is vaccine supply. And thus far, we've been able to do kind of smaller hard site clinics targeting specific groups and been able to get through our vaccine supply as the allocation comes in. But what my team's been tasked with is building a plan with public health on how to expand that operation and make it scalable for the future when we do get more vaccine. So over the past couple weeks, 2-3 weeks, we've been working on expanding our volunteer pool. As of yesterday, we've sworn in 60 medically licensed volunteers that can help with the vaccination efforts. And this is through a system called Disaster Healthcare Volunteers. So these are nurses, doctors, and other medically licensed people who have just stood up and said, hey, I want to help get vaccine into arms in Humboldt County. We've also been working on identifying some large sites that we can implement a drive-through model in. Drive-through model is nothing new for us. We've had plans in place since 2009 after H1N1, and it's something that we've tested just about every year through the county's flu clinics. But the major differences between the flu clinics and the COVID-19 clinics is number one, the cold chain storage or the supply management issue Dr. Hoffman alluded to, and then the requirement for observation post-vaccination of COVID-19. So for those of you that don't know, after you get the COVID-19 vaccination, you have to be observed for a minimum of 15 minutes and up to 30 minutes if you have medical complications such as a history of anaphylaxis or reaction to an injection. So ways that we're looking at mitigating that in our drive-through model is by color coding vehicles. So if you have a history of medical issues post-injection, you'd be given a green tag on your vehicle that indicates 30-minute wait time, and an orange tag for everyone else who's going to get a 15-minute wait time. So that poses challenges for the site. We have to find not only a building or a location that's large enough to have multiple drive-through lanes, but also has to have coverage from the weather because we're entering the rainy season, and also has to have adequate parking space so we can separate out those two lots. But my team's been working on locating sites, and we have 3 or 4 that are looking pretty good. We just have to finalize the memorandums of understandings or MOUs with those sites. But in short, we have the staff, we have the supplies, and we have the locations, and we're ready to go. We're just waiting on additional supply. So what we're going to be doing in the coming weeks is implementing a drive-through model on a smaller scale. That way we can start kind of working out the kinks and testing the process and perfecting it prior to implementing a larger scale model. And as of last night, just in terms of progress with appointments, 700 appointments were sent out. The links were sent out to law enforcement and emergency services personnel. So we are starting to work into that phase 1B, tier 1. And as we start progressing and getting more vaccine, that'll open up a little bit wider. But right now, we're poised, we're ready to go. It's just waiting on that supply to come in before we can open this up on a broader scale. And that concludes my report, unless there are questions.
All right. And Ryan, I'd say I've never seen you, I don't remember seeing you without a mask before. So it's like, wow, nice to see you. Okay, well, I do have Supervisor Bohn. I know you have a question, but I'm going to go to Supervisor Bushnell and then follow up by Bohn.
Hi, thank you. Good morning, Dr. Hoffman. So my first question is, how many people in Humboldt County have been vaccinated to date?
Big question. We are working hard to figure that out because we're not giving the vaccine directly through public health. We don't know all exactly who's been vaccinated, but we're working on when we originally had this plan, the plan was to use the CARE system, which is the state database, to track that information. But you've probably all seen the reports that that database is not tracking accurately, which is why the state and the federal level are having a difficult time themselves also tracking that. So we're taking a different approach locally. We're going to start gathering data from our partners weekly, have them report to us, so then we can report out to everyone else. So at this time, I cannot answer that. I could hazard a guess, but I can't give you a specific. But we have finished phase 1A. We're moved through phase 1A, which was 10,000 people in Humboldt County. Obviously, not all of those people took the vaccine, but a great majority of them did. And we're moving into phase 1B, tier 1, which is 75 plus, which is about another 10,000 people. And as Ryan mentioned, we've started into first responders who were not part of phase 1A, the police, fire, law enforcement, and we are actively planning with the teachers for sending out appointments in the very near future for the teachers to get vaccinated. In fact, we have a meeting after this to discuss that very thing. So we're moving, that group is about 7,000. So if you take all the folks who are on right now, you know, it's about 27,000 people in Humboldt County who are in the list.
How many?
So 27,000. So we haven't had that many vaccines though. So we don't have enough vaccine for all of them. So we take the phased approach, just like we have all along. So the line isn't so big that the people in it are, you know, are able to get an appointment when it's their turn.
So thank you. It's kind of odd that when you require a second vaccine booster that we don't have a number so that we can't calculate how much vaccine we need for the second shot. So that I hope we can get better numbers and have an actual. My second question is that I understand the phase system, and I'm wondering why Humboldt County phase system is different than the state of California's phase system for obvious reasons I can understand. But I am very concerned that the teachers seem to be being bumped down continually. And
No,
I'm not done.
No, that's not true.
But I'm not done with my
Let her
question.
ask the question, please, Dr. Hoffman.
When you look at the phase system in Humboldt County, teachers aren't even listed. And I understand that you're saying it's not true, but I'm wanting to know, like, where are the teachers in that system? When you list them, they always seem to be going down. And I think it's really important that we get the teachers vaccinated that are currently in school and then get the teachers vaccinated so we can get our schools open.
Michelle, I'm not aware that the teachers have ever moved. In fact, we at the county level have never changed our priority tiers.
If you look at the phase system, Dr. Hoffman, they're not even listed in the second phase. In the state of California, they are. It's not on your phase sheet. And
I beg to differ.
Well, I'll send you the email that I got. But thank you. That's just a question. I'm just trying to get clarification. And then also my last question is for the 75 years and older, and you said that they have to fill out the new form that went out yesterday. Is that just because, or I thought they were right there and ready to be vaccinated, top of the priority list for the second phase? But some people that they don't have internet or they don't have access to that form. So can you explain that, please?
Sure. There are a lot of ways that people are trying to do outreach to those groups. And so this is one of many attempts to reach that population that we thought we would have more access to vaccinators at this point. So we're now trying to create ways to get those people in, and the plan changed. Not from our plan was always the same, but the state has changed. So people can, if they are not able to fill that form out themselves, we would ask a family member or a loved one or a neighbor or someone to help them fill that out who does have internet access. We're reaching out to agencies that help these populations to see if how they can assist us in getting folks in to appointments for 75 and older. We're reaching out to doctors' offices to have them reach out to their patients who are 75 and older. And, you know, we're working on ways to increase our staff who could take phone calls and, you know, fill it out for someone over the phone. The state of California is also working on that at the state level to create a larger system for people to express their interest and get into clinics.
So thank you for that, Dr. Hoffman. Is it a must to fill out that form to get vaccinated?
No, it is not a must.
Thank you for that clarification.
Yeah.
And thank you for your answers. I appreciate it.
And before I go to Supervisor Bohn, I did want to say, I know that there are a lot of in-depth conversations happening right now with the schools and with public health. And I think from what I can tell, we're just not ready yet to be trotted out so we know exactly what's happening. So I do believe there are a lot of those, and hopefully we will be able to hear more about that soon. And you know, so I just say at the end of this, perhaps Dr. Hoffman or Michelle can give us a little update on when we will actually know more, because certainly people are asking. This time, Supervisor Bohn.
Well, thank you, Chair Bass. Dr. Hoffman, I think part of the problem is I know the Madrone thing set us back, and I know you had said in a statement that you had 2 mass vaccination clinics set up, and then the Madrone setback pushed it back. So are we redoing those? We're not reinstating those. We're going on to a different plan. Did I read that wrong? I'm looking at it.
We, the vaccine team has determined that those do not need to be activated at this time, so they still remain. The extra clinic is ready to go. Should we need it? Should we have the vaccine? But there were enough partners in the community who built their capacity larger over the course of the last month with vaccine efforts, that extra clinic was not needed this week. So it's ready to go if we get more vaccine, or if for some reason, another clinic isn't possible. But at this time, we're meeting the demands with all the clinics around Humboldt County.
And then in response to, I think, Supervisor Bushnell's question, I guess the best way, how many first doses have we got sent to us? That'll give us an idea how many have got out, because we're getting them off the shelf. We're not keeping anything on the shelf, I would imagine. So how many have we received? I know we're keeping track of that. Aren't we?
Well, those
away from what CVS did for the rest homes, which I applaud. That was fair.
So, yeah, exactly.
That's a different factor. How many has public health received?
We have only received a small portion as public health. They go directly to the hospitals, to the clinics. We only receive a small portion of them. I want to say, I think last week I said 12,000 we had received total doses. So it's 3 more thousand. It's about 15,000 right now. We get a proportion based on our population of what the state gets, and we get 0.4% of the whole state allocation. That's why it's more or less the same every week, but they do shift it around a little bit. Some weeks we get 300 Madrone doses, other weeks we get 600. There was a week that we got over 2,000 Madrone doses. So it is, like I said, it's a little haphazard. We haven't got a steady supply ever, which makes it difficult. But it's around 15,000 doses total. That's first and second doses.
Okay, we don't. So if they send them to the hospital, which they all go to the hospital for storage, don't they?
No, they don't.
Okay.
Only the Pfizer goes to St. Joe's.
All right. Okay. And then where do the Madrone go? So they'll just send 100 to a doctor's office? We don't.
Only the approved providers, which there's only about 8.
Yeah. Okay. And then I guess the only other thing would be, I think, just as, as I'm reminded, I'm not a doctor or a scientist, but I am asking the fact is I know, and I'm sure my fellow supervisors do, in excess of 20 or 25 texts or calls a day. I mean, nothing approaching what the JIC does or anything else from teachers. My first teacher text this morning was at 5:12 a.m. and it was from a school teacher wanting to know, when are we going to get vaccinated? Could we, instead of saying, hey, when we take all the numbers, take all the alphabet numbers, take all that out of the mix and ask, we have 3,100 people in education in Humboldt County, K through 12 total. So we need 3,100 vaccines. When will we be able to set up, 1,500 one week, 1,500 1 week from the teachers? Because if I'm hearing right from the governor's office, and this is the second part of the question, once we get first the law enforcement and the teachers done, he's going to go just back to ages, right? Is it because we're spending so much time trying to figure out who gets it? We're letting people,
Yeah.
So instead of having that big meeting, okay, who's essential, who's not, we're going to get the teachers out of the way, and then we're going to start. Is that right? Did he say we're going to go by ages after we get those next two?
I don't know. They haven't put out a stable policy yet. There's a meeting going on right now that was emergency called this morning, and that I'm missing. I think Director Stevens jumped on that. It has not been announced what their new plan is.
Okay.
So I want to be extraordinarily clear.
Please.
Plan, which is up on our website, includes teachers in phase 1B, tier 1. If you go to the Humboldt County website, you can see that. It's never changed. It has been there for weeks. And we are working closely with the teachers, very closely with the teachers, to schedule their clinics as soon as the vaccine is here. And I'm hesitant to give exact dates because we don't, we have these populations and we can speculate about how many people will take the vaccine in those populations, but they're just speculations until we've offered everyone in that group, the 10,000 healthcare workers, and we're not waiting to vaccinate every 75-year-old in that 10,000 to do the teachers and law enforcement. We're doing these, this is a parallel tier now. We're working them alongside each other. So 75-year-olds are getting their vaccine now. Law enforcement and first responders have almost entirely been invited. And the teachers we're working with right now to plan the clinics for the coming weeks. So, if we had enough vaccine to just do all the teachers, 3,000 in 1 week, of course we would do that. You can see by the numbers though that will not work out. We weren't sure if the vaccine supply was going to increase. We were told that it would by February, and that's not happening. So we just take it week by week, and that's how we plan these clinics too. We see what we have and we plan the clinics according to what we have for the next week. So I do feel confident that the teachers are going to be up in the next weeks. We will not be able to do all 3,000 at once, obviously. So we've worked with HCOE to come up with a tiered system within the teachers as well, to start with folks who are in person first, and then move into hybrid.
And I think part of the confusion from some of the people is when you pull up the Humboldt County vaccination timeline on our COVID site, and you go to tier 1, tier 2, tier 3, 1A, 1B, 1C, teachers are not mentioned anywhere.
Yeah.
I know it's been there for months, but it's not there.
Yeah,
and it's not listed.
Right,
and I don't know if that's a confusing part of it. I know they are there. We keep talking about it, but we can't give them a timeline. And I think I think part of the problem is getting these. I'm having trouble finding it on the other tiers even. I was just on the first tier. So if we could get that clarified, and I think the teachers, I don't think they want an exact date, but are we week after next? Could we plan on week after next to do a group, or is that a possibility? Because it isn't the 3,100 teachers. It's the 23,000 kids that are being taught by those people that ends up being the issue.
Sorry, Supervisor Bushnell, Supervisor Bohn. I'm looking at the website right now. It says Tier 1, Phase 1B, Education, Childcare, Emergency Services, Food and Agriculture.
Okay, I see it on phase. I thought you were talking, it's not on the 1As, tier 1, 2, and 3.
No.
So we're talking maybe a month then, because we haven't even got through tier 2. I don't know. I'm sorry. I'm not trying to upset you. I'm just trying to get answers. I'm asking the questions to get asked to me.
I've answered the question, Supervisor Bohn. I've answered the question. They are in phase 1B, tier 1.
Appreciate it.
They've always been there.
Thank you.
They would never move. They have not moved once.
All right. Thank you, Supervisor Bohn and Bushnell. And I think part of the challenge is that it being 2 shots required, because it seems like, well, wait, people are getting their next shot when others haven't got their first. And that's unfortunately, in my opinion, I think it's part of the problem. But are there any other supervisors that would like to ask a question or make a comment at this time? I don't see any. Supervisor Wilson?
Oh, just a quick and basic one. Do you have the phone number that I can distribute? Because in terms of signing up for the list for those people who don't or can't do it online, so that we can just, let our neighbors that aren't so internet connected have that ability to connect. So if you could pass that off, that'd be awesome. And we as citizens in Humboldt County can reach out to our less connected, at least internet connected neighbors and let them know that they can call this number.
Yeah, so if you go to the interest form website, it lists the phone number to call, and it would be through the JIC.
All right. Okay. So what you're saying is those of us who are internet connected, go to that form, find the number, and then we'll do that. It's fine. I can do that. I don't mind.
441-5000.
Yes.
Does that one work? Okay. The same number that we ask for all information. That's great. I love that number, 441-5000. Everyone say it over and over.
Or you can go to the website and look it up.
I do want to caution though, we are actively trying to get people to fill it out, themselves if possible. Obviously this is an enormous undertaking for a small group of people to try to get that filled out for potentially thousands. We've already had, like I said, 7,500 filled out. I think it's probably 10,000 this morning. That was from last night. So if it's at all possible for someone to fill that out for you who has internet, if a family, a neighbor, please know that that is a preferred way. And then, if it's not possible, we are working on getting more staff, but the JIC has seen, as many places have seen unprecedented number of calls in the past 2 weeks, specifically since the announcement by HHS Secretary said that we were opening to 65-year-olds because everyone thought they were going to be able to get a vaccine, and that was not the case. So that was very disruptive to many of us in public health, and we're still, trying to deal with that over the last 2 weeks.
Thank you. And I'd like to remind my fellow supervisors, let's try to not talk over each other because it does get a little bit hairy to try to follow and track that conversation. Supervisor Wilson, to that, do you have any other questions? Then Supervisor Madrone and then Bohn.
No, thank you very much. And I'm thankful for this report. And I do know that there is just so much anxiety and almost panic to try and, find where everyone can get the vaccinations. And so it's definitely a pressure cooker. And I appreciate that. And it's true, like a few weeks ago, there was just a huge push in terms of the phone calls that I think all of us were receiving from the 65 and over constituents, and rightfully so, wanting to get vaccinated and where can we get vaccinated. And so I'm hoping that this information is helpful with that. And a lot of this confusion in terms of numbers, I believe, comes from the fact that we have so many different providers. We don't have a single payer system, or we don't have a healthcare system that's aggregated into one thing. It's just all kinds of private providers, as well as you say, you guys have 10% of the actual vaccination. So I can understand how difficult it is, but as you can see, information is key. Even in this dynamic environment. And so keep at it, and hopefully we'll get this done as soon as possible. Thank you.
Okay, Supervisor Madrone and then Supervisor Bohn. Oh, and then Ryan Derby, did you want to comment on something prior to the supervisors?
Just really briefly, the goal is to not let any vaccine sit in storage longer than 7 days, right? So we get our weekly allocation, and the goal is to expend all of that before the following week. One of the challenges is with these clinics, we're oftentimes scheduling before we have the allotment for the next week. So I know Dr. Hoffman's been kind of lobbying to the state for more vaccine, but I encourage all of you in a position of influence to lobby to the state for additional vaccine, because like I said earlier, we're ready. We have the people, we have the places, we just need the supplies. And if we can raise that voice up and get more into the county, then we can get this done faster.
Thank you, Ryan. Supervisor Bohn and Supervisor Madrone and then Supervisor Bohn.
Thank you, Madam Chair. Difficult conversations. I just wanted to thank Ryan Derby, Ian Hoffman, Michelle Stevens, and all of our frontline workers for all the incredible work that they're doing. You know, as a public, yes, we're all anxious. The anxiety is over the top, as Supervisor Wilson said. And there's been a lot of changing information out there from the state, from the feds, et cetera, which has created a lot of frustration. But this is not the time, folks, to panic and to start getting really angry at each other and, you know, making massive phone calls and email texts, you know, demanding this and demanding that. I mean, this is the exact time where we all need to take a deep breath and realize that help is coming. It's not here today. It may not be tomorrow, but when we look back in 2 or 3 months and go, wow, we made it. We're there. Things are getting better. We've got half the population vaccinated, whatever it might be. You know, we're going to wish we hadn't been so antsy and creating so many problems for people that are already working overtime, trying to do incredible efforts. And when we get angry with people and start just, you know, slamming folks, well, this and that, what, you know, it's like, gosh, that just makes it a lot harder for these folks that are on the front lines trying to help us. And I think Ryan just said it really well. It's the supply issue, right? We've got plans, we got places, we got people, we're ready to do it. So if you want to, if you need to make a phone call and a text and pressure somebody, pressure the governor, pressure the state to get these supplies going, pressure the federal government, you know, to get on board with a plan federally and make things happen. And that certainly looks like it's picking up steam now and ramping up. So that's the good news. So let's just take a deep breath, you know, settle down and let things play out. We're going to all get there together. But I just really wanted to thank Dr. Hoffman in particular. I know that you came in at a really tough time, taking a lot of heat, and I very much appreciate your efforts and everyone else. So that's really all I have to say. I think all the questions have been asked and answered, and appreciate it. Thank you very much.
Thank you, Supervisor Madrone and Supervisor Bohn.
Just so you know, I'm not angry. I'm just asking questions that I get asked on a daily, and I'm only asking the ones that get asked of me 10 times. So, hey, Doc, I'm trying to figure out, do we have any type of an idea? Can we say end of February for teachers? I mean, I'm not asking for an exact date, but for the 3,100 first vaccinations or to start the teachers that are in the classroom, who I know are first in line, do we have any idea when we're going to start that? I know I talked to Chris Hartley, and like you, I've been talking to a lot of superintendents who have been calling, and I'm just trying, do we have any idea of a date? And then the other thing is last week I got a form from St. Joe's, an interest form, and it's kind of like ours. It's a little bit different. I filled it out. I tried filling ours out. It wouldn't take my age, so I know it's not because I'm the oldest person there is in the world, but so I'll try ours. But if we filled out St. Joe's, do we need to fill ours? Are you guys trading the information, or is it proprietary?
I think that if your medical provider sends you an interest form, you should fill that one out. You can, of course, fill out both. We're targeting more the people who don't have that insurance, you know, who don't go to St. Joe's, who don't go to Open Door or the other large places where they are vaccinating right now. I know there's some Southern Humboldt interest forms out there as well. And so we're kind of targeting through public health populations who don't have access through those other providers. You can fill out all the interest forms. It's okay. The point is we just want to know who wants the vaccine, and when their time is up, we're going to send out, you know, appointments to those people. And you know, the more we know, the better we can reach out to folks.
And teachers, can we tell the teachers anything?
Yeah.
The education field?
Yes, we are in direct communication with Chris Hartley on a daily basis. So we've been planning for weeks with him. We are very likely to be sending out invitations this week to the teachers, to some of the teachers. So again, we need to look. We don't have our allocation yet for next week, so we need to look at the allocation. As Ryan said, we have to plan these things week to week. But I am feeling confident that we will be sending out invitations to teachers this week.
And then for what day? For next week? I'm sorry, I'm not trying to put you on spot. For 2 weeks? I mean,
I'm not
Okay.
I have a team that is involved in planning, and they work closely with the teachers to make that happen. So what I would say is, if you're a teacher, I think, like as Supervisor Madrone said, let's practice some patience right now. We're not forgetting about you. We've never changed anything. Not once has our priority changed for teachers.
All right, that's fine.
And we will send out the invitations. When you get your invitation, you will see scheduled appointment times, and you can select which one works best for you.
Dr. Hoffman,
Right.
may I, to try to see if we can pull something together so Supervisor Bohn feels maybe a little more confident. I believe before the teacher invitations go out, hopefully that you and others, Michelle and the group that's working with the schools will know prior to that. And I think, it sounds like they may go out this week. Can we at least count on some type of communication in the next several days that really does pin this down to some extent?
I meet every morning with our team to talk about vaccinations and plan the appointments. And so we try our best to give fair warning, and that's what we're trying to do with the teachers as well. Chris Hartley, HCOE, has sent out communication to the teachers about this, and yes, as soon as we know when those clinics are, we will let everyone know.
Okay, and thank you. I believe you're trying to be super careful because conversations are still happening with the schools. So I appreciate that. But I think the board needs to know that in those conversations, I believe there will come to some type of consensus, and we will get that information. It's like, I understand Supervisor Bohn's frustration because we do get a lot of calls, but I also understand that I know the conversations are happening. So as soon as we're able to get that information, so we can at least start allaying some of the fears that people have, that would be just greatly appreciated, at least from my perspective. Are there any of the supervisors that have a question at this time before we go open to go to the public? Okay, I guess not. We have a couple of people. If you're interested in commenting on this item, please do call in now so that we don't miss you. And our first commenter is actually Roland Richmond at number 6699. Welcome, Roland. Hello, Roland. Are you there? There you are. Welcome.
Thank you very much. This is Roland Richmond. I'm representing the Humboldt State's Emeritus Retired Faculty and Staff Association. We sent a letter to all the supervisors a couple of weeks ago, and I'd like to thank Supervisors Bass and Wilson for their remarks and for all of your conversations this morning. I would just say that one of the important things that we believe is necessary is that we get multiple ways of informing people in our community about the availability of vaccines. For example, in the Times Standard this morning, there's an article with a discussion of this and a link to the interest form. That's very good, but there are a lot of people who don't have access to the web. And as I think Supervisor Wilson mentioned, that would be a good opportunity. So thank you very much for working hard on this. We do need a clear plan, and we need a lot more conversations and information for people of various ages and times. Thanks very much for your help. I appreciate it.
All right. Thank you, Roland. And we have two more speakers at this time. The first one will be with the last four digits of 4841. And the next will be the person who has the last four digits of 5288. So 4841, welcome.
Hi, this is Cherry Reese, and my concern about the priorities is that per the LA Times yesterday, 3/4 of the deaths in the state of California from COVID are 65 or older, and we seem to be still vaccinating. Our priorities seem to be risk of exposure versus risk of death. We're going to vaccinate law enforcement before we start. I really think we need to reconsider, because the whole purpose of the vaccine, not necessarily the purpose of the vaccine, but one of the major goals was to reduce the number of deaths. That's what the CDC said when they recommended moving 65 and older up the priority list. And it's also what the state of California said. So thank you for the time. Just wanted to put my 2 cents in. Thank you.
Thanks. Thanks, Jerry. Good to hear from you. And then our next person is ending the last 4 digits of 5288. Welcome.
Guess who this is, Virginia? I got 2 phones. I've been tracking this quite a bit. I really wish to thank Dr. Hoffman for finally coming out with a way where we can try to participate online. I signed up on Monday. I was a little bit disconcerted to see in the article that 3,000 people got ahead of me because it was a soft sign up. When I wanted to find out about about vaccines in Humboldt County, I went and researched in the phone book, Health and Human Services Department, phone number 268-2108, and that's the immunization clinic. I used that number, and then they were very helpful. They referred me to another number, which I don't have. That number should be up on your screen, or somebody else should bring that forward. I had it, and I don't see it on my note board here, unfortunately. But I did start the tree as far as some people who are not quite as old as I am, which I'm 66 years old, do not, it's just about insulting to assume that we have the ability to get this information and be referred into a circle where we have to participate through technology. It just does not happen. So number I started with was 268-2108. I got off the phone with Open Door Clinic a little while ago because the forms that I filled out to get on this list said you checked Open Door Clinic. And now when I called Open Door Clinic, they had a message machine, which was informative. It sounds like I just about have to re-register through Open Door Clinic. And my question is, when I register there, does that automatically register me with Open Door Clinic? That's a major concern if people think they're registered and they're not on a list. I'm really confused about this whole process, and I strongly support the teachers. I would like to do this thing. I have important business. I have traveling to do, which I'll do either way. With or without the vaccine, I have impaired breathing. You can tell I wheeze all the time. Sound like Darth Vader. But anyway, let's get those teachers. There's some people are typical politicians, and I hate to be accusatory of that, but don't dodge questions, answer them outright. And there should be no secrets. There's some plan we're having, and we're developing this. That should be brought out. We think we might be doing it this time. Give it an EWAG, an educated wild ass guess, and that's the surety that people need. And I'm quite confident in myself, but there's a lot of people less confident out there, and they're extremely stressed. Get it to the teachers. I concur with the last speaker, but I guess that's selfish being in that certain category. I think that basically the children are pretty resilient. Some of us aren't. And we would appreciate a little more attention and transparency. And the websites you have here and things. I did notice. I think we're only at 4.9, which technically should put us in a way down tier. I don't know. It's like a third down tier as far as that goes regarding that particular stat. And thank you for my time to speak.
All right. So I did have one other person with their hand up with the number last 4 0140. I do not see them anymore. So at this point, we will return it to the board. And I don't know if any parting comments or Dr. Hoffman or Sheriff Hansel, Ryan, do you have anything extra to add to answer any of what may have come up?
Yes, thank you. I do just want to say that our goal is to be as transparent as possible through the planning process. So there are multiple plans in addition to what's posted on the county website, what was submitted to the state. And we're currently working on aggregating those all into a single document that we can post on the website. So in the coming days, probably in the next week, everyone will be able to access the on our website and see what the back-end planning process is and what that translates to in terms of a mass vaccination clinic. So right now it's in clinical review. We just want to make sure that all the clinical components are sound before it goes out publicly, but those documents will be made available in the very, very near future.
Supervisor Wilson?
Quick question for Ryan. Well, I have seen great reports and actually experienced really easy and quick turnaround for getting testing, because even though we're still vaccinating, people still need to get tested, and everyone still needs a mask. Just reminding, like, keep on that. I don't want to lose sight of that. But I have some have asked for like an aggregated list of testing sites. Do you think that's something that the JIC can pull together? I know it would be something that would need to be updated probably periodically, but I was just kind of wondering if that was on the table.
That's something we can look into. I know right now we have the county sites that are sponsored through the testing up on our website. It's been challenging since the onset because there's so many different testing modalities that maybe we weren't aware of or happening, either in a private clinic or at a pharmacy. But we can work on gathering some of that information. But at least for the immediate, we have those Optum state locations posted.
Thank you. And again, everybody keep masking. It's very important. Even if you get vaccinated, it's still very important. Thanks.
Thanks for bringing that up, Supervisor Wilson. I will take that as an opportunity to remind everyone that we are still recommending testing. We would like more testing. We have seen a statewide trend away from testing in the last several weeks. The capacity is much greater now than it's ever been for testing. So OptumServe often has same day or next day appointments available, and most every medical provider in this community can do a COVID-19 test. So please get tested. And once you're, also a good point about the vaccination, that, we have to continue all of our distancing. We have to continue masking, and gatherings are still not permitted, even if you have a vaccine. We need to wait until we see decreased community spread to really lift those measures.
Right. I don't see any other hands up from the board. So we'll let you get on about your business. And sounds like some of the JIC calls, hopefully, or the calls are dying down a bit, since now people do know where to go to start filling out the interest form. Oh wait, there is one more thing. I believe one of the callers asked, what happens if you are you belong to the Open Doors group of offices? Should you be filling out more forms? What happens if someone fills out the form that we have as an interest form as well as their own provider?
Yeah, so the providers who have vaccine are reaching out to their patients directly. So you don't need to call them. If they have an interest form, you should fill it out for that, if you're part of that practice. And then our interest form is really, we'll share it with those entities. If people fill it out and they say they're an Open Door patient, we can share that with them. We just started collecting the data, so we're going to start looking at how to share that, in the coming days. And the other thing is, it's not like a wait list. It's not like you have it's not like we're ranking people. We're just trying to gather the information, and then we just like we've done with all the groups, we see what the interest is, and then we take groups of people and we send them invitations to clinics that fit their, what had been profession based on the phase 1A, and now in phase 1B, tier 1, their profession in that, and then also creating clinics for folks who are 75 and older who don't have access through their medical provider. And again, this is all changing because everything has changed in this vaccination effort. We were promised more providers at this point. We were supposed to be enrolling more of the smaller clinics to be giving vaccinations at this point. We were supposed to be getting more vaccine at this point, and none of those things are happening. So it's a challenge. It's a very challenging time in this vaccine effort, but I feel very confident about this team that they have every challenge. They have done an amazing job and will continue to, as things certainly will change again in probably the coming days and weeks.
Great. Thank you, Dr. Hoffman. And I will give the sheriff, do you have anything else you'd like to add, or you don't have to, but if you do, let me know. Nope. All right. Thank you. Well, then we'll move on to our next. I'm going to change the items here because we do have a 10:30 time set, and I also want to make sure that we have a brief break before that. I think C8 might take us a little bit longer in conversation, so I'm going to bring that one back. And I'd like to move on to one of the matters initiated by board members. And I do believe that's coming to us from Supervisor Wilson regarding the loss of local programming. And I'd like to turn it over to you at this time.
Oh, thank you. That's unexpected.
Well, the time kind of kept going too fast, so
that's okay. You think this one's going to be easy and fast? Okay, good. I'm glad. So
I didn't say easy and fast.
So as all of the supervisors have probably received communications, probably just about at the same time as the sort of vaccination communications from many of our constituents. There was also a change in service associated with Suddenlink and some of the channels that they carry. And there was a lot of concern about that because those channels provide local programming, especially news programming. And so this seems to be a conflict between Cox Cable and Suddenlink, but it also bleeds into the issues of regional and national aggregation or conglomeration of these media sources. And so I'm not the expert in this realm, but I wanted to make sure that we had at least a brief presentation on sort of what our response is with relationship to that. And so I've asked both Sean Quincy and Sean McLaughlin from Access Humboldt, Sean Quincy from our CAO's office, to briefly give us, a report. And I don't know who's going to go first, so they're going to have to duke it out there and figure out who's going to jump in and give us what they know. Thank you.
Well, we can say Sean, and either way, we're right.
Right, I know. Sean 1 or 2. Yeah. I think they even spell it the same. So.
Hey, aloha is my line. I think Sean Quincy was going to take the lead, and your staff report is really well done, so I trust him to do that.
All right. Good morning, Chair Bass, members of the board. Sean Quincy, Deputy County Administrative Officer with the County Administrative Office. And you're right, Supervisor Wilson, as with many things in government, this issue has many layers and a series of historical events that have led us to our current state. I'm not going to go blow by blow into it, but I will try to provide some relevant context around this issue. And essentially, it's born out of a contract negotiation between two large corporations, as you talked about earlier. But due to changes in state law, there's limited authority that local governments have in those negotiations, let alone the programming that a cable company offers. Specifically, the Digital Infrastructure and Video Competition Act of 2014, it's a state law, requires that cable companies in California, including Suddenlink, operate under state-issued franchises and not local franchises. And these franchise agreements allow cable companies to contract with TV stations and retransmit their programming through the cable company's wireline cable service. Those contracts come up from time to time, and renegotiation in those contracts led to our current dispute. Now going up a level, the regulations on how cable operators function, now those regulations are governed by the Federal Communications Commission and Congress. So it's a national regulations, federal regulations. And in this arena, Congress can change regulations and take action to return authority to local jurisdictions, which is something that the county advocates for strongly. For example, Congressman Huffman in the last Congress introduced the Local and Independent Television Protection Act, which would limit the national audience reach of broadcast stations. It remains to be seen what will happen in the next Congress, but that is definitely something that Humboldt County can advocate for. And then finally, very quickly on the local front, Suddenlink does use public streets and rights of way to lay the actual wire line that eventually hits local residences. Suddenlink pays local jurisdictions, and they pay us a franchise fee and a public education and government programming fee, known as PEG fees, as a condition of use for the rights of way. And the DIVCA that the state law I mentioned earlier, it does require that the state franchises, those with state franchise agreements, provide certain PEG access channels, which is where Access Humboldt comes in, and they have several channels offered on Suddenlink service. And so with that, I'll conclude my report and be available to answer questions.
And sorry, through the chair, if I may, we also have Sean, the Aloha Sean, here from Access Humboldt, who also might have a little historical context. Excuse me, because one of the things that one of the things that I kept receiving from folks was this question of, don't you have franchise? Doesn't the county have a way to leverage diversity of these services? And so, Sean, I heard a little bit about that from the other Sean, but maybe you want to expand upon that, because there seemed to be some historical context about what people maybe used to understand about that. And as I can see, it's before my time. So,
well, maybe I'll try to just give a quick overview again, in a way highlighting what Sean Quincy outlined and maybe addressing your question, because as Sean Quincy pointed out, if you ask in this dispute between the two, if you ask Suddenlink, what they're saying is they want to make sure that it's a fair rate that they're paying for access to those channels. And Cox Media Group, if you ask them, they're calling Suddenlink anti-consumer. So it is confusing to people who receive those two messages, and those are the two parties really in play here. And I think the bottom line that we all recognize is that ultimately the cost is going to be borne by local cable subscribers. So whatever the agreed upon price is, it's going to be your constituents who pay for that. So I think I guess I want to say your letter, your staff report and your letter are both really well composed and well done. So I don't want to be redundant, but I think to your point that Sean Quincy also mentioned, the state law changed about 14, 15 years ago. And so people who remember what the county and the cities did back then to negotiate the franchise, to create Access Humboldt, to set aside channels, to get funding for these things ongoing, that was under a different state law. So DIVCA is the law that came into effect right as Humboldt was forming the new access model. And so we were lucky in that was grandfathered in when the state preempted local jurisdiction. So we still have Access Humboldt. I mean, a place like Del Norte, maybe they wanted to create an Access Humboldt. They wanted to follow our model. They can't do that now because the state law restricted their ability to do that. I think the other big impact, maybe to put it in real practical terms, is the Digital Infrastructure and Video Competition Act. The way it's phrased in the letter is correct. It eviscerated local jurisdictions' authority to protect ourselves. It basically took away almost all of the oversight that the county and cities have. And it basically said, if there's a dispute between the county and the cable company, which is not exactly in this case, but there have been issues, like we're doing an audit right now for the county and cities of the franchise fee payments that they pay to the jurisdictions. And so that's a residual authority that you have that we're enforcing now. And if people look at their cable bill, they'll see, hey, Suddenlink's paying $4 a month to the county or the cities, right, for their local franchise fee. And that was all negotiated back under the old regime. What they're seeing now that we have no control over is a whole nother line item on their bill. It's called local broadcast fee. Now, 5 years ago, that was maybe $1 a month. It was less than the franchise fees. Today, if you look at your cable bill, that line is $15 a month. So what has happened? Well, a couple things. Broadcast TV stations were bought and sold and consolidated, and the 6 local broadcast stations in Eureka are now owned by 2 absentee owners. Sinclair owns 4, and Cox Media Group owns 2. So so in this case, Cox is negotiating with Suddenlink, which is Altice, and we're one of 6 markets. There's 10 TV stations in 6 markets that are part of this negotiation. So what can Humboldt do about it? You know, in terms of this immediate dispute, not much. We're one of 6 markets, and mostly our hands are tied. So that's why it gets complicated. The first answer is there's no immediate jurisdiction that the county can enforce them to put those channels back on the air. That's not in your authority. So what can you do? And so in your letter, I think you do a good job of pointing to what can be done. We can ask Congress to give us back some of our authority to oversee broadcasters, have a different kind of oversight. You used to be able to go to the local broadcast station, look at their public file, talk to the owner, and say, hey, how come you guys pulled your channels off? And you might have had somebody local to talk to. Part of the frustration now is there's nobody local you can talk to, right? I don't know how many of you actually were able to reach a human being to find out what was going on with this, but it's not easy, right? You have to call Texas. You have to call Atlanta, Georgia, to talk to the management in this dispute. So I think again, I want to refer back to your letter because I think it's really smart. You're calling on Congress to do what they can do. And fortunately, Representative Huffman is on top of this, and so keep informing him of what our problems are. We're asking his influence to have the Federal Communications Commission really look at this whole across the nation. This is a problem. Local TV is being bought and sold, so it's not local anymore. And it's just doing deals outside of our communities. So a localism task force is something that used to exist that you're calling for again. And then you get to the closer to local and the point about DIVCA. The legislature could fix DIVCA. They could give you back your jurisdiction. They could give you back the ability to protect local consumers by state law. They could basically go back to the authority that you had. That's a huge... The political people will say, no, that will never happen. Cable industry is way too powerful. AT&T is way too powerful. I mean, essentially what they said when they persuaded the legislature to adopt DIVCA is if you let us do what we want to do, you'll have competition. So in theory, the theory was if you didn't like Suddenlink, you could turn on your AT&T TV service, but AT&T didn't make the investments. So we don't have AT&T video service. So there is no competition for cable in the market.
All right.
Anyway, I could go on, but I think
there's some questions for you, Sean. Or Sean. Supervisor Bushnell, then Supervisor Bohn.
Thank you. I just really want to thank Supervisor Wilson for bringing this forward. I've had so many questions and not quite understanding it. So clarification from both of the Seans is very welcome. Thank you. And I really appreciate the conversation.
Great, thank you, Supervisor Bushnell. And Supervisor Bohn?
Yeah, I wanted to thank the CAO's office and Karen Clower, because Karen used to run all of these things before she got into ADA, so I keep running to her. And I want to thank Supervisor Wilson for bringing this forward. I know it's a letter, and hopefully somebody reads it. But it's like Sean said, we can't compete with AT&T. I think we go back to the 60s, I think it was Dr. Dolfini and Elliot Stanton that started this. And Dorothy Lofault was the first general manager, and out of 600 cable companies, she was the only woman in the 60s who actually ran a cable company in the U.S. So that was as local as it could get. Up until 5 years ago, we knew the managers. And as Sean said, there's a wall that you can't get through. And it's just... The problem with local TV is we have to realize the advertising dollar is not there anymore because everybody wants to advertise on the internet, and there's so many other and stream things on the internet. So, it's not as important, except when you get to the people that really watch their local stations and not much else, or just can afford basic cable. And you basically take the basic out of cable. So Sean gives a pretty good idea, but he also lets us know that this is such a little pebble in AT&T's you know, AT&T, when it's not just, it's a little more than a switch. I don't think they can repay the equipment because our market's so small. And you'll see that in Greenwood, you know, back there where they're having the problems too. So again, I thank Supervisor Wilson for bringing this, because I mean, we could all be in Hawaii if we didn't have COVID and cable right now, but it keeps our phones busy.
Thank you, Supervisor Wilson. Supervisor Bohn, you're absolutely correct on the phone busy part on this. And I do want to thank the people that a lot of folks did email in comments. The amount of frustration is totally understandable. So glad we're having this conversation. At this point, I'd go to public comment, and no one has their hand up in public comment. So I think everyone like completely is on board with this. So at this point,
playoff games are over.
Yeah, we'll go back to the board and see if there's a motion to move forward with this. Yes, Supervisor Wilson.
I'll make a motion.
Right.
Supervisor Bohn. You'll second it, Supervisor Wilson?
Yeah, if the motion is to move forward with the staff recommendations on these letters, basically.
Yeah.
Yeah. And then I'd just like to close and thank the Shawns for pulling this together. And if I could, when today or later, I'll ask staff to aggregate that into an email, including the time stamp for this conversation, so that so that I can send those out to constituents. So they can view this conversation directly, and I'll make sure that all the board members are given that same information. Thanks, guys.
Oh, Sean, aloha.
Aloha. I just wanted to thank the board for your leadership. I think it's known across the state that Humboldt County pays attention and is ahead of the curve on these things. And I also want to let folks know that Access Humboldt will continue to do this work. I mentioned that we're currently auditing Suddenlink on behalf of the county and cities. Our thinking is if the community really wanted us to, that is, if we could do fundraising and maybe raise another, it probably cost about 50 grand. We could do a very detailed billing audit of all the Suddenlink bills and potentially, you know, make more of a difference. But it's one of those calls where, anyway, I'm not doing this as a fundraising call. I'm just saying that's about the scale. If you wanted to do more than the letter, there is another increment of effort that could be applied, and that's about what it would cost to do that next step.
Thanks for that, Sean. Yes, Supervisor.
Through the chair, I do want to thank Sean and Access Humboldt, and just point out that we are lucky in our community to have that community-based video and media access infrastructure, because so many rural communities don't have this. I mean, it just doesn't exist, and we were, as Sean mentioned, kind of just on the tail end of the ability to do that. And I want to thank the leaders from 15 years ago who and longer than that to get to that place. I mean, I think again, it's like we all hope to establish and do things that people in the future will appreciate, and so thank you to our past board and activists on that as well. Thank you.
Thank you, Supervisor Wilson. And I do believe that I was involved in that while I was at the city of Eureka. So it was quite the experience. All right, so seeing no other questions, Ryan, may we have a roll call vote, please?
Thank you, Chair Bass. Supervisor Bohn?
Yep.
Supervisor Wilson?
Yeah.
Supervisor Madrone?
Yes.
Supervisor Bushnell?
Yes.
And Supervisor Bass?
Yes.
Thank you. Passes 5-0.
All right, and I do know that we have the 10:30 time set, but I do want to give a chance, at least a 5-minute break. Is 5 minutes okay, or do you want 10? 5's okay. All right, we'll take a 5-minute break. So we'll come back, we'll make it 6 minutes. We'll come back at 10:40 for that item. Allowing that brief break. So this time we'll move on to our 10:30 time set, which is being brought to us by our CAO and office regarding the budget review and budget outlook. So Alicia or Amy?
Thank you, Chair Bass. Today, I will be turning this over to our Assistant County Administrative Officer, Alicia Hayes, who will be sharing with you today's budget report. And I just want to thank the management and budget team and the departments for their tireless efforts on the work of the budget. Administering a $465 million budget is an incredible amount of work. And our Assistant CAO does it with an incredible amount of grace and dignity. And so I thank her very much for that.
Thank you, CAO Nelson, for those kind words. Good morning, Chair Bass and members of the board. I am Alicia Hayes, the Assistant CAO in the County Administrative Office. And I do have a presentation for you, so I am going to share my screen. All right, is my presentation showing? Yes, okay, fabulous.
Alicia, your notes are showing.
My notes are showing. Great.
I thought it was closed caption so I could make sure I heard what you said.
Okay, bear with me. Technical difficulties with Zoom, of course. Let me switch it over to a different screen and see if that helps. Are my notes gone now, CAO Nelson?
We are not seeing the presentation at this point in time.
It's all gone now.
It's all gone now. We need like a view screen.
There you go. There you go.
There we go. Okay, thank you very much. Good morning, Chair Bass and members of the board. Again, I'm Alicia Hayes, Assistant CAO. And today I bring before your board the budget review for fiscal year 2021 and a budget outlook for fiscal year 21-22. Today's report begins the budget process for the coming year. Your board will be asked to establish the parameters for developing the fiscal year 21-22 budget. Next week, the budget will kick off with departments and staff will present those parameters approved today and provide departments with the necessary tools to develop their budgets. In March, the Citizens Advisory Committee on Measure Z expenditures will evaluate applications and prepare recommendations which will be presented to your board on April 13th. Budgets will be due to the CAO in March, and the CAO staff will work through those and compile the budgets into one comprehensive document through the month of April. The proposed budget will come before your board on June 8th with budget adoption taking place on June 29th. Typically, when staff bring a budget review to your board, the year-end fund balance is reviewed as well as any variances, and often your board has the opportunity to allocate additional funds to other departments or projects as a result of excess fund balance. Since fiscal year 19-20 is not yet closed, it is not possible to review fund balances across all funds, and it's also not possible to effectively review the current fiscal year variances as the first and second quarters for the current year have not yet closed. Because of these outstanding items, the County Administrative Office recommends a status quo budget for fiscal year 21-22. This means that the general fund allocations will not increase except for those departments that received an increase in the current fiscal year, and also with exception to Measure Z. This also means that increased costs in health insurance and other costs will need to be absorbed by departments. The County Administrative Office will adjust the budget at a later date when all of the outstanding items have been completed. In addition, staff recommend that your board accept and consider requests for additional general fund appropriations with a preference given to one-time requests. And finally, your board typically receives budget presentations from departments during the month of May prior to final budget adoption. Feedback has been received that board members would like an opportunity to engage departments earlier in the budget process to allow for board input on development of the department's budget. Given a status quo budget is being recommended by staff, your board should determine if budget presentations would be beneficial for the fiscal year 21-22 budget, and if so, develop a schedule for hearing those presentations. Moving on to Measure Z, probably the most exciting part of today's report, the fiscal year 2021 budget was adopted with the use of $1.6 million in fund balance due to budgeted reductions in Measure Z revenues following COVID-19. Measure Z revenue is now estimated at $11 million for fiscal year 2021, exceeding budget estimates by $1.6 million and reducing the need to rely on fund balance.
Due to increased revenues and expenditure savings anticipated in fiscal year 1920, the fiscal year 2021 budgeted fund balance is estimated to be just over $1 million, of which $527,504 is recommended to be carried forward into 2021 for KMUD to complete the emergency broadcast update, Orleans Fire Department to complete construction of a fire station, to finalize the Measure Z audit, and for the fire chiefs to complete the remainder of their projects. As reported by departments and upon review of outside agency invoices, it's estimated that Measure Z expenditures will be under budget by approximately $319,000 due to salary savings in the Sheriff Measure Z budget unit. Overall revenues are estimated to exceed expenditures by $799,330, leaving funding available for allocation by your board. Staff recommends that your board review the recommendations from the Measure Z Advisory Committee, which are attached to today's report, and provide direction on whether the allocation of the remaining funds is preferred. Once your board adopts additional allocations for Measure Z, staff will return at a later date with a supplemental budget. In conclusion, there's a number of recommendations contained in today's report that require direction from your board. Those include setting the parameters for the fiscal year 21-22 budget development, providing direction on allocating additional Measure Z funds, determining if your board would like to hear presentations from departments on their fiscal year 21-22 budgets, and if so, developing that presentation schedule, directing staff to return at third quarter only if budget parameters established today require substantial changes, and providing any other direction as needed. With that, I conclude my staff report and will gladly answer any questions your board may have.
Alicia.
Supervisor Bohn, thank you.
Now, Alicia, I think we talked on this. The positive sales tax, and I always appreciate you guys for underestimating or taking the safe approach so we're not scrambling. But I guess a lot of this is has to do with the hardware, building and garden supply, a lot of it. And then we're starting to see the first full benefit of the Wayfair decision. Is that pretty much a pretty good synopsis?
That is an excellent synopsis. Early in the year, we were developing our budgets in April, May of last year, right on the onset of COVID-19. We heavily relied on Hinderleader and Delamas and Associates to help us as industry leaders in forecasting sales tax projections. Obviously, this is an unprecedented event and very difficult for even the experts to articulate where sales trends might go in the future. They equal to us were surprised by the positive performance of Humboldt County, attribute a portion of that to our rural location. But as you said, a large portion is people locked at home doing home renovation projects and feverishly spending online instead of going out to stores throughout closures.
And one last thing, I want to tag on to our CAO. Last night, I got a very frantic phone call from a fire department's board meeting, and they were down to $26,000 in their account when they should have had well over $600,000, and they were kind of worried. Called our CAO. Our CAO reached out to Ms. Hayes, and I got my answer in 5 minutes. So I really appreciate it, and they really appreciated it because they had about $40,000 in bills. So hopefully we can get that rectified. So thank you.
Sure. Any other questions for staff at this time? Okay, seeing none, I think I'll go out. Oh, would any department heads like to comment on this as well? Sorry about that. I've only got half the screen of people and I have to keep going back and forth to try to catch everybody. All right. Doesn't look like any department heads have their hand raised either, so we will go out to the public comment on this item. And we have one person, and if anyone else is interested to call in to this item and make a comment, please do your call in now so that we know you're there. Our first speaker is Kent. Welcome.
This must be about the 10th budget or 11th I participated in. I did find it seemed to be 2.5 pages of trying to state why the AC is to be blamed for everything that's wrong in the county. The budget used to be prepared, and I think it still is required to be prepared as two groups involved in this, the CAO's office and the auditor controller. I would think maybe that maybe this can stop. I did make a comment before. I'll be honest with you, I've done it myself. When you know somebody's not there, you've got somebody in a meeting, I can call them 4 times and say, well, I called that person 4 times and they never responded to me. The finger pointing needs to stop. I would hope possibly that the year-end budget will be done now after having wasted so many days and so much time of the auditor controller regarding potential investigations. That might even be the difference between that having not been closed as of now. You definitely need, since there's all kinds of complaints regarding that, you need some policies where the departments are required to have all their entries in within 30 or 60 days after the end of the year, instead of having people come in the day before Christmas wanting to keep the process open. Have the AC continue to do posting, and there's some policy changes that need to make this so that we don't have an excuse for having to just carry our budget forward and the finger pointing can stop. I have not really reviewed this totally. I think probably within a couple weeks, things may be closed. Who knows? Look forward to having the budget all closed, and then you can actually do a budget and not just carry forward the next year's and put your staff to work. I'm guessing that they probably have a pretty good idea. I'm really happy to hear that we have more sales tax and people stayed at home and spent their money locally here with our local business people, and that is a pleasant surprise. Also for the redwood industry locally, where the people were still buying fence posts from Home Depot down south of our second growth redwood. That's been a great boon to our society, to our local economy also. So thank you for the opportunity to speak on this. Of course, I will have many more comments a little bit more in depth. Surprised that you're not getting any input from your department heads at this time, but I do strongly appreciate you willing to reach out and talk to them individually or however you're proposing to do that and get input rather than last minute for those last little 700,000 or 800,000 that happens to be there each year. Thank you for my opportunity to speak.
Thank you. There was one other number of 0140, but they have dropped off the screen. So with this, I will go back. Okay, just in time. This is going to be the last speaker unless people call in now. So 0140, welcome. Glad you were able to get back on the screen. You may push. There you go. Welcome.
Hello?
Yes. Hi.
Hi, board members. Thank you so much for allowing me to call in. This is Jeanette Hurst. I'm the executive director for 211. Just wanted to call and ask you guys to look over the proposal that 211 put together for Measure Z funding, and to hopefully look at the emergency and safety call report that I sent you guys on the amount of calls that we've had that I would consider under safety measures. We had over 656 mental health crisis calls. That's up by 278 from last year. 279 domestic violence calls. That's up by 196 from last year. 92 suicide call hotlines, up by 58 from last year. 1,297 public health call transfers from the California Public Health Department, up by 839 from last year. 4,789 COVID information and at-risk calls. 3,059 of them were sent over to the Office of Emergency Services. I can go on, but you guys have the report. And I just really, listening to Ryan over at OES and Dr. Huffman about the public health form that needs to be filled out, we would like to offer our assistance, if we could, help in any way for getting those forms filled out. If you'd like to have people call into 211 and we can set something up, if we get this funding, to where we can actually hire another person and not actually have to lose the one we have. Can you guys hear me?
Yep. Yes.
Okay. It's so quiet. Thank you all for allowing me to bring this forward. I know it happens every year. I know that you have the Measure Z people. I'm not really sure why 211 is not listed as a safety item in our community. We are definitely working with on the state and federal level now to get funding for 211. The federal government has actually come to us to try and work out some kind of information sharing in order to, and an MOU or some financial assistance to take over some of the non-emergency calls to 911 during these events that we have. We're getting a lot of calls in from the PSPS outages, and they're not even PSPS outages for the most part. They're just storms that we've had. But people think, how long is it going to be out? What do I need to put supplies in for? So a lot of people are calling in our community for that. And a lot of people are calling in. We've had dozens of calls from people calling in about the not being able to get the local news. It's very important to them. And our senior calls have more than tripled this year. Usually we didn't get a lot of calls from seniors. And now we're seeing quite the uprise in senior callings, especially for those.
Thank you very much,
homebound.
Jeanette. Sorry, 3 minutes passed. Thanks. Thank you for calling in.
Thank you, Virginia. Thank you, Virginia. Bye-bye.
All right, and seeing no one in the public queue, I'll go over. Supervisor Madrone has his hand up. Well, welcome. Of course, welcome.
Thank you, Madam Chair. Yeah, I just wanted to shout out for 211 and Jennifer Hurst, and I assume that proposal will go in with the rest of the proposals to Measure Z, and I believe they'll be meeting in March and providing us with recommendations in April, and I certainly hope that they're able to receive that support, but that will be up to the Measure Z committee and then ultimately us at the board. But at this time, I would like to make a motion basically to adopt staff recommendations, including receiving and filing the review of the current fiscal year and the budget outlook for 21-22. Number 2, to direct the county administrative office to prepare the fiscal 2021-22 budget proposed on a status quo general fund allocation, which includes setting department allocations from the general fund to remain the same as in fiscal year 2021, with exceptions for Measure Z and those departments that have received increased ongoing general fund allocations during the fiscal year 2020-21. Additionally, accept and consider requests for additional general fund appropriations with a preference given to one-time requests. Number 3 in the motion is to review the estimated unallocated Measure Z revenues along with the recommendations from the Measure Z Citizens Advisory Committee, attachment I, and provide direction on whether to allocate funding, and I'll get back to that in a second. Number 4, to determine if departmental budget presentations will be held in 2021-22, and I certainly would like to encourage that to occur, and to direct staff to return at the third quarter only if the budget parameters set forth in 2021-22 require substantial changes. And so to go back to the Measure Z allocation, I would like to add to that the staff recommendation that we approve the balance of funding that is available to go to $18,259 for KMUD to complete an emergency broadcast upgrade, $127,882 for Orleans Fire Department, volunteer fire department to complete the construction of their fire station, $17,155 to finalize the Measure Z audit, $364,208 for the fire chiefs to complete remaining projects. And these are all staff recommendations, so I would move all of that. Thank you.
I'll second that, but there's a part of that that needs to be determined.
Yeah, there's some work we still have to do, but
yeah.
So we do have motion for staff recommendation, second, but there are pieces that we have to fine tune. Yeah, so my Supervisor Wilson, I'll let you cover that. So
yeah,
so that we
the only issue I just want to touch on, because there's a couple in there, which is the scheduling of departments to give budget reviews in a more substantive manner than we've had in the past. I personally am willing to hold off a year on that recommendation, although, you know, a year ago, fully on board with having that be a change. And the reason for that is, quite frankly, you know, all of our departments, every single one of them has been in crisis for the last year, in terms of they all have staff that has been pulled out, some percentage of their staff pulled out to deal with COVID response, and excuse me. So, and amongst other things that, you know, and not just pulled out into that response, but also, you know, have gone to their work from home, and all these other changes that have occurred have really caused a lot of hardship within all these departments. And so from that perspective, I would be totally willing to put off until the next budget cycle those department at that department level review at the board level. And I'm sure that as board members, we can sit with or talk to the CAO's office if there's particulars in there, but that's kind of where I'm at. If the board chooses to want to have those reports in the way that we had thought about in the past, or the way it's been expressed, I'm okay with that too. But I'd like us to really consider, you know, the impact on our departments at this moment in time. Yeah, that's where.
Okay, thank you, Supervisor Wilson. So I see that as a conversation point, as well as and maybe Alicia can correct me, but it looks like we may be able to do some additional allocation if we wish to of some of the Measure Z funds based on the list that we received. I'm not sure that's accurate, or we don't have to.
That's correct, Chair Bass. You have $799,330 that is available for allocation. And I would refer you to the Citizens Advisory Committee letter of recommendations. As a reminder of that process, they did rank those recommendations in order of priority. Through the adopted budget, your board did get through a portion of item number 6, which was the City of Fortuna Police Department School Resource Officer. $162,435 of that application was not funded. And then it follows in order 8 through 27, all of the applications received. And on a side note, in regards to the comment from Jeanette Hurst with 211, she is an applicant in the current fiscal year that would be eligible for allocation should your board so choose. She's number 26, or 211, excuse me, is number 26 in the list of recommendations coming from the Citizens Advisory Committee.
Alicia, is there a way you can put that list up somewhere on the screen? I mean, I'm looking on my stuff and I think it fell off somewhere because I remember seeing it, and I don't know if others have any interest in that or not, but we do get to go through and have that conversation.
Yeah, so
I wish my eyes were better. But.
Can you see the list here? Is it up?
Yeah.
You need it a little bit bigger.
Can you? Yeah.
Okay, so again, 1 through 6 has been funded, with a portion of 6 being left unfunded, the 162,435, and then going on in suit. So really, your board should be most interested in these items on this page and the next page, which remain unfunded at the current time.
Supervisor Wilson?
Can you just remind me again what part of the 162,435 has been unfunded, or is that just been taken off? I guess I'm unclear.
Can you stand by for one moment and I can definitely pull that information up. For the City of Fortuna, the school resource officer excuse me, the drug task force officer was funded at 103,937, leaving 58,498 unfunded.
Oh, okay.
And
So
then
that's really
the
number
SRO is completely unfunded at 162,435.
Wait, the SRO is unfunded, but the drug task force is funded?
A portion of the drug task force.
Is that because it's just leftovers from the, what, can you explain why that is?
Because the way that the committee ranked it, they ranked from 1 through 27, and we gave them a dollar amount of how much funding would be available. And then that once they hit that threshold, which was this $3 million right here, that's where this funding ceased. So it partially paid for the school resource officer, did not yet dip into the drug task force. It just happened to fall right at that cusp of where the funding ran out.
Okay, sorry, I was just clarifying. So the drug task force agent has not been paid or has not been budgeted necessarily, but only a portion of the Fortuna. And again, can you give, what was that number one more time for the portion of the Fortuna school resource officer?
Yes, the school resource, and I'm sorry, I actually had that wrong. So I'm going to back that out. The SRO was fully funded, the 162,435. This 103 that remained, that dipped into this 162 for the DTF. So we've got 58,498 remaining for the DTF officer. I'm sorry for that confusion.
That makes much more sense, in terms of like what I see in front of my screen here or what you put up. So I appreciate it. That was just a clarifying. I wasn't sure about that. So through the chair, do you, I mean, we've had this discussion often about whether or not we kind of go through this, and there's certain proposals. One is like pick at it from our different viewpoints about what we might like to see off this list. Give it all to roads has been something that, or apportionment. And then sometimes it's been proposed, but I don't think we've ever done it, which is to just roll it over to Measure Z to the committee for the next year to make that decision. I don't know where I stand with that necessarily, because I don't really see any of this list that necessarily that we couldn't wait to do that, but I'm happy to have this discussion.
All right, thank you, Supervisor Wilson. Any other supervisors? I don't see any other supervisors at this moment. I do appreciate, I guess I'll take advantage. I appreciated, Alicia's explanation there. And it's interesting looking at the list because Supervisor Wilson is right. Sometimes we do come at the perspective of our districts in many cases. And I did want to point out, because I did not realize it was on here, and maybe it's not the right time now, but for future, Harrison, for those of you who know anything about Harrison Avenue, know that half of it is city and half of it is county. I mean, literally right down the line of the road. So it's always a challenge. There are problems with it, and maintenance is something that we have to do in an effort together. So I'm glad that they did actually put in for some funding. I don't know if it'd make it this time, however, but I just wanted to say I was appreciative when jurisdictions work together. So any supervisors have, Director Mattson, sorry. Welcome.
I just want to bring up, since you brought it up on the Harrison overlay project, that if you go ahead and allocate the funding this year, we have allocated funding from HCOG on a short-term basis to make that project virtually whole, since what's left won't get us $350,000, but more like $200,000 if it was allocated today. But we do have a standing offer from HCOG for about $105,000 that we could bring to that project. But that money has a short time frame for expenditures on it. So I would request your consideration of allocating the funding today for Measure Z. Thank you.
All right. Thank you very much, Director Mattson. Supervisor Madrone.
Thank you, Madam Chair. Well, I certainly would support Director Mattson's request there for funding that tune for the other half of Harrison there. That's a very important project. It's been trying to get done for a long time. I think that would be really important. I also just wanted to point out of those 4 projects that staff recommended for Measure Z funding that are due to the balance, the increased balance from last year. For the Orleans Fire Hall, I do believe that it is urgent for them to finish that hall over this next construction season. Often what happens with Measure Z is that the committee brings us recommendations in April. We make final recommendations in April or May. It gets into the budget, and then the county proceeds with putting contracts together, and they work really hard to do that. But often those contracts don't come in until September or October, which pretty much wipes out most of the construction season. And given the kind of fire seasons we're having these days, I really think it's important for us to put these resources into our the extreme edges of our county. So for instance, for KMUD to finish their broadcasting system emergency work is critical to Southern Humboldt. I mean, they provide an amazing service down there for the whole community, and that's at our southern extreme. And the same can be said for Orleans. Anybody that's ever been up there knows there is not any kind of a very large community place for a fire hall, all that stuff. So they've been volunteering all of their labor and constructing this fire hall, and they need this funds to get it finished. And given that that's also way out at the extreme ends of our county, I think that's really important. And I think both those projects would really benefit from getting done this year rather than not knowing when the funding might come and delaying it for a year. So I think that's really important. Thank you.
Thank you, Supervisor Madrone. Alicia, is there any way you can put up some type of a spreadsheet like we've done in the past with that we can kind of look at what the dollars we're talking about and subtract along the way to see where we're at?
Madam Chair, while she's doing that, may I add just one last comment?
Certainly, Supervisor Madrone.
Thank you. I wanted to say that I agree with Supervisor Wilson's comments earlier about the workload right now on departments and staff, and I would be fine with waiting a year for those more detailed early discussions about budget processes. I don't want to put additional stress on our departments at this time, so I appreciated that suggestion. So thank you.
All right, thank you very much, and thank you, Alicia. Can you make that a little bigger?
Absolutely.
I even have my new glasses. That's better. Thank you. All right. So, can I ask if we put in like tentatively what Director Madsen suggested, since there seems to be some support of that, and I don't know if it's and that can we put that in as the 200,000? If the other money is short time money, it means we do need to take action. I assume from what Director Matson said. So, but the 200,000 was the amount he mentioned. Does anyone else want to answer? Supervisor Wilson.
Yeah. In the interest of again trying to be fair about the distribution of allocation. We have in the past, given some apportionment directly to public works because we know that gets spent fairly evenly, and Tom does a really good job of really making sure that every corner of the county is served with regards to that. So I would be amenable to looking at some amount of money, maybe an additional 350,000 to that line item just to start with, which would be number 17. I'd like to hopefully we talk in terms of these numbers. Number 17 would be great. And then this is a conversation I've brought up a few times. I really would like to have the Measure Z committee consider I know some of them are probably listening, that there be some apportionment of the Measure Z funds that goes to small grant allocations, maybe like $10,000 or less, so that smaller organizations that can leverage those funds for more resources be accounted for. But we have 3 on here that are 10,000 or less. One is the Garberville Town Square, and I'm not asking you to put these up here. The other one is the People of New Directions, which is kind of cleanup stuff, and the other one is College of the Redwoods for CERT funding. These are really good examples of small, smaller grant funding that helps, really lift up smaller pockets of our community. And I just really would like to see us have a focus on that in the future as we move forward. Again, I'm happy to look at that now. And this is a question for Tom. Tom, I know that's not a very much money looking at this $350,000 when you're asking for on your thing here, 1.5 million. But also, you have on here the 80,000 for illegal dumping. And I can tell you that, I think all of us get a lot of feedback about cleanups. And I know that when you look at it, it's not just you guys picking up stuff for illegal dumping. Is this not the budget you also use to help, deliver dumpsters and things like that to community groups, or no, is that different?
So let me preface it by saying that my original request for the 200,000 assumed that the items recommended by Measure Z above the Harrison project were fully funded. So I wouldn't want to step on their toes, although I will take anything possible you can give to roads. But we have multiple sources that we use for illegal dumping. And so at the Redway transfer station, we have $1 surcharge on every ton disposed that we use in that community. In each of our franchise areas, each of our franchise agreements in solid waste has a certain number of bins provided that we allocate out to community cleanups. And then a lot of it just comes simply right out of the road fund, reducing road maintenance. And that's our primary push for trying to get Measure Z funding for illegal dumping so that we're not promoting road maintenance funding. Thank you.
Through the chair.
Yes, Supervisor Bohn, and then back to Supervisor Wilson.
And I know we're talking around $400,000, but I go back and I guess maybe I should have said something on the last item. Yeah, we also have, I'd like to ask, Public Works lost about $505,000 for fiscal year 2018 and 19 and 1920 about some issues with the indirect rate cost proposal. And hopefully we won't have that in the future, because that was over $500,000 that we could be working towards Mattoll Road or anything, or picking up trash or anything else. The Public Works did take a $500,000 hit, and I think that this is why we need to offset some of this with Measure Z. I have a little bit of an issue with using Measure Z for that, but I understand 100% he needs to have that back in his budget somehow, because we couldn't get it.
All right, Supervisor Wilson, did you have more to add?
No. Again, I feel like as much as I want to do all of these things, I'm okay with increasing the Public Works budget as part of this, because again, we hear a lot about that, probably more than any individual item on this list. I'm open to suggestions from the board on where we might go with that.
Thank you. I'd like to give Supervisor Bushnell. She's not raising her hand, but I wanted to give her. Oh, there's her hands up. That was perfect. Yes, Supervisor Bushnell. We planned it.
Thank you. I just had a couple questions. I'm asking specifically, so the Harrison Avenue Road resurfacing and repair is $350,000, but on the line item allocation that we just did, Alicia, was $200. So if we put the $200 right there for the Harrison Road, is that sufficient? I guess I would ask Director Mattson.
We believe so, because we, after measures, we found out what was left on Measure Z. We met with the city of Eureka, thought we would probably get 200,000. So we went to HCOG and got an allocation from HCOG that almost brings us up to the 350,000. And with the city staff, we were confident with roughly 310,000, I believe we would have with the HCOG allocation, we could do a fairly substantial complete project.
Okay, thank you. And then Alicia, can you go back to your other, there, thank you. So the city of Fortuna with the partial funding of the drug task force agent, what was the remainder? 50 something?
$58,498.
So is that up for consideration in this?
Followed by pound.
Yes.
Okay. So that would be completely funded?
That would completely fund their DTF officer for the year.
Okay. And then the items that Supervisor Wilson were talking about of the grant, I'm sorry, could you switch back to the other screen? This one, the committee consideration allocation for the small grants, where is that being up for discussion or, and then also I would like to talk about the KMED funding. It's not on this line item, correct?
Supervisor Wilson, maybe you would like to speak to your intentions with that. I perceive this as a message you would like for me to bring back to the committee for the new year.
Yeah, so first of all, I think that the KMUD stuff is in that 799330, correct? So all that list that Supervisor Madrone went through is that 79330. And so right now it's on the table.
Yeah, so let me, because I'm trying to understand, this is new for me. Supervisor Wilson, so those items, Alicia, can you confirm those items are already in for consideration?
Correct. Yeah, those are applications that were funded in the 1920 year. They didn't expend all of the dollars, but they're sort of projects that are in the works. So whatever is unspent, we just carry forward and reallocate in the new year so that they can complete those projects.
Okay, so those are already being considered.
Yeah, and that's deducted from the total amount. So without less those which are already, being carried forward pending your board's approval, you still have $799 on top of that available.
Yeah.
Okay, so I'm sorry, Mike, but can I ask one more question then? So the 211 consideration, is that in up for funding or not?
That is, yes, it is. It's item number 26 on the list. So it is down towards the lower priority in terms of the committee's recommendations, and it's an allocation of $46,100, which is being requested.
Okay, and then back to Supervisor Wilson's consideration for the small grants, which are you asking Supervisor Wilson that those be considered higher? That's what I would like to know.
My consideration that I'm asking for from Measure Z committee is that they consider basically carving out a certain amount of money, whether it's 100,000 or 200,000 or some amount of money that's specifically for small grants, and that the call kind of goes out, or that there's a request for proposals for smaller type grants that then that are prioritized by leveraging other funds or other things, so that smaller community organizations have an ability to apply for these sorts of things. I mean, they still do, but sometimes they just kind of get lost in the wash because they're so small and they're kind of put aside, and it feels like they're not as important. But in aggregate, if you had 10 or 12 of these, they would actually could have a lot of importance. And also it helps to engage the community more, I believe, to have that opportunity, because they're not agencies necessarily. Maybe they're smaller agencies or smaller organizations. So that's the idea. And I'm just hoping that the Measure Z committee would consider that. And the subject's been brought up before. I just keep pestering about it. So, and I have to say, this conversation reminds me of 4 years ago at my first Measure Z and this list came up, and how I was like, oh my God, like how am I supposed to advocate for, for my constituency and the community at large, and in kind of the first time roll through. So I totally hear your, where you're at on this. I am empathetic to where you're coming from. I do believe that, we've seen a lot of interest in the CERT program lately, and I'm just kind of wondering, that does have a very cross, Humboldt County, it covers everybody. So I feel that maybe that is in terms of, it's not site specific, but Humboldt County specific. And I've heard a lot of really great responses from the CERT program. So I was just wondering, if we might want to consider that as moving forward. But again, I really do favor putting a more of this money into some of the road stuff, because again, I do think that Tom does a good job of helping us all, and I mean us, the entire county, with a lot of our needs and issues. But in terms of the small ones I see here, I really favor the CERT one right now.
Could I get,
go ahead.
I'm sorry, could I get clarification on one more item? So Alicia, will you pull back up, I believe, to the other, there. So the 80,000, the Humboldt County Public Works illegal dumping, I'm just unclear again what that, so we have funding for certain amounts, which I understand what Dr. Mattson said, but this additional 80,000, would it be lumped in? Is it for different items, or can you explain, Dr. Mattson, a little bit?
So what we've used that money for in the past is people dump hazardous waste on the county roads, having hazardous waste cleanups. People use some of our, Shelter Cove is a perfect example. We have a cul-de-sac up there that turned into a major dump. And so it's basically for dumping outside of franchise areas where we don't have any other way to pay for it other than out of the gas fund for road maintenance. So it's basically, it's backfilling our road maintenance fund for funds that need to go on our roads, instead that we're having to use to clean up toxic and regular garbage.
So with that being said, then it is directly for the county employees to, or for nonprofits like we do. I know we do fund some of the nonprofits for.
Yeah, this is directly for dumping in the county right away.
Okay, thank you for that clarification.
Thank you, Supervisor Bushnell. And I do want to say Supervisor Bohn's computer died, so he is now joining us by audio. So we will be sure we keep him on this question list. Supervisor Bohn, since I mentioned that, do you have anything you'd like to add at this moment?
Chair Bass, I'm gonna have to, he's gonna go in the attendee queue, so I'm gonna need his phone number, and I'm gonna have to find him and unmute him.
Okay. Well,
so let me.
Can we go back to the spreadsheet again, in case we wanted to plug some more things in? I know it's hard with all the projects that are all worthy of our help, but I'm going, again, with Tom Mattson, Director Mattson, wherever we are. Can you go again, after I've heard a couple comments on the 80,000 for the dumping. I know we have a lot of stuff in the right of way, so I'd really like to give you whatever you need in there. So I don't know what your thoughts are on that. Is the 80,000 what you'd like? Because I think all of us get a lot of things dumped in our right of ways, and we're always calling you.
So 80,000 is actually what we have expended currently this fiscal year to date within our county right of way. So yes, that would drastically help us balance out our budget and get some road maintenance done this spring. So like I said before, I will take anything possible you can provide the roads, because Roads have always been severely underfunded, and anything extra we can do is a bonus to the community.
And then also the dumping, the $80,000 is what I'm specifically asking about. Okay, it's part of the same. Okay, Supervisor Madrone.
Thank you, Madam Chair. I really like this discussion. I just want to get clear. So my earlier mention of Orleans Fire Station, K-Mud radio, said those things are just carryover items that are unexpended funds that are being carried over to this fiscal year for them to complete projects that were already allocated last year. Is that correct, Alicia?
Can you repeat that? I'm sorry.
Yeah, so the 4 projects, the Orleans Fire Station, the K-Mud stuff, those 4 projects listed in the staff report, those are just carry forwards. We're not really having to recommend funding for that. Is that correct?
That's correct.
Okay, so those are already taken care of. They don't need to be part of this discussion about the $799,330, correct?
Correct.
And I believe that Supervisor Bushnell was also clarifying that earlier. Thank you, Supervisor Bushnell. I was confused there. There's so many pieces to this puzzle all the time. At any rate, I would like to suggest, I won't make it into motion. I'll just make it a suggestion to see how this works for the board, because it seems like this is sort of the final part to this motion to complete this item, perhaps. And that is that we allocate $200,000 to the Harrison Road project, $80,000 to the county dumping program, cleaning up hazardous waste, $7,600 to the Garberville Town Square, $1,747.99 to Access Humboldt to complete their emergency backup. As we heard earlier today, we are so lucky to have Access Humboldt here in our community. $10,000 to New Directions for safety equipment for cleanups. And if you don't know about them, they do an amazing amount of work in our community, Northern Humboldt, cleaning up homeless camps and all kinds of other problems. $7,900 to the CR CERT effort, $46,100 to the 211 proposal. And then that leaves a balance of $445,962 that I would recommend would go to the roads department. I know it doesn't completely make up for what was lost, and they always have a need for whatever we can supply them. So I would just offer that up as a slate of possible projects we might consider for this $799,330.
Supervisor Madrone, where I was trying to keep up with you, you were going fast. Were your proposals for the dollar amounts equal to their request, or did you reduce those down some?
No,
if so, can you give me those amounts?
Yeah, no, those are all equal to the requests that are shown on the Measure Z committee's letter. So I just took those straight off that list.
Perfect.
Yep. And I really like what Supervisor Wilson was trying to do there, in that, we have a lot of smaller funding requests, and by taking care of those, we get funds out to a whole lot more programs and projects that make a really big difference. So I like that approach.
Okay, well, thank you for those suggestions, which we can certainly work with. I know Supervisor Bushnell has her hand up.
I was a little confused, Supervisor Bass, when you said that the $80,000 you said was included with the $350,000, but that is not true, correct?
No, I think that $80,000 is a separate piece of public works.
Yep, and that's really important. And then Alicia, can you please go back to, okay, so that leaves 95. Can you go back to the other list?
Of course, we don't have to spend everything.
Why not? And then scroll up, please. Thank you. Okay, thank you. I appreciate that.
And I have my own clarification to ask because the writing's too small for me to actually see again. What is the status of the drug task force officer? I mean, we had some money? Are we doing any money for it? I don't see it on here, and I'm just trying to, because that was next on the group's list. I just was trying to figure out, were we planning to, well, if we're planning to add something there. And I guess that would be, I'd ask Ms. Hayes about that.
To add it, can you repeat that one more time?
Yeah, I just was wondering, since you know, the group does give us their ranking on the list, and I didn't know. I know the resource officer in Fortuna, you know, we were able to deal with that, but now with the drug task force one, were we able to put anything towards that?
No, not with this proposal that you have right here.
Okay.
But I mean, that's up to your board's discretion. If you follow this recommendation, reduce something down to accommodate it.
Okay.
There's options.
I just wanted to get that clear. And I'm going to go, yes, Supervisor Bushnell.
Alicia, can you go back to that? I'm just wondering about the Riadel. Oh, that, thank you. So right there, do they staff, do you know, is this a full staffing with help from them or full staffing from Measure Z?
Yeah, this is full staffing from Measure Z. This frees up a deputy who does clerical work to patrol streets and allows for them to actually fill that position with a clerical office person. This is a position that they've had for a number of years and then just fell slightly short in this fiscal year.
And has Measure Z funded that previously, you're saying that, or no?
Yes, yeah, they have measured, they have, I want to say maybe 4, or, I mean, I think that Amy, maybe you recall, I believe that they've been getting this position almost since the very beginning. And last year they did receive a reduction in the total amount. And, you know, they were able to cut costs in other places in order to make it work. But yeah, they've had this position filled by Measure Z for quite a while.
So I'm so is this currently, this position would not be funded the way we're going?
Correct.
It would not be.
Correct.
So I'm going to ask that we do fund it at some level. If we could go back, please. So I'm going to ask that we fund it and reduce the remainder, because we've already given to roads several amounts, that we fund this for Riadel. And then split the difference with the county roads.
Supervisor Wilson.
I do want to point out that, you know, we're starting to get into, there's Garberville Town Square, now there's Riadel. I'm just saying, there's, you know, and so we're getting into a space where, you know, we're leaning into sort of district specific requests, and so I'm just, and also I would note that I just read an article about you know, an increase in the budget associated with Riadel recently in terms of their revenue. So I don't know if that's different than, you know, from before when they put in this application versus now. So, I mean, I'm just saying, I was like, it's looking at this list, I have 2 sort of district specific things, and then and actually 3, we have the roads, Harrison. So I just want to, you know, point out that some districts are not getting the sort of specific line items in this discussion, which is why we tend to, at this point, lean towards, you know, those roads and those sorts of things, because we know that the allocations are, you know, a bit more evenly divided. So.
Supervisor Wilson, I'm actually going to follow you, and then I'll go back to Supervisor Bushnell. One thing I did want to mention about Harrison is it actually it touches 3 of our districts, literally, plus the city and the county. So that's why I don't see it as much district specific, but I can understand the majority probably would be considered in mine, but it does touch all three of the districts. So.
And through the chair, I would note that, we have received a request with a relationship to the drug task force and a report on that in the past with relation to the Fortuna or the Eel River Valley. And we had this discussion kind of between the drug task force, which covers kind of a large area, including Rio Dell, and versus, Rio Dell specific. And I don't mean to pick on any particular space, but I'm just saying in terms of like the impact, we have, last year we had this discussion and the board leaned more towards the drug task force allocation as opposed to the Rio Dell because it was a broader community that was represented. So I'm just throwing out there conversation. I'm not hardcore on this. I just wanted to make sure that we have that in our mix.
Thank you, Supervisor Wilson, and I do remember those conversations as well. And I don't know if the sheriff would like to weigh in at all on this. I mean, to me, the drug task force it's not just someone that works with Fortuna. I think it works with the group as a whole, but I could be wrong. So if the sheriff can help me out there.
Yeah, thank you, Chair Bass. This is a position that's been funded through the Measure Z funds for the last several years, 3 years, I believe, and it's a position that is countywide. The task force is operated under the sheriff's office, but it is a joint venture between Eureka, Fortuna, Arcata, California Highway Patrol, and the sheriff's office. So they do countywide, drug investigations, and so it is a position that's definitely needed and funded.
Great, thank you, Sheriff Hansel. With that, that's where I'd have my preference in putting some extra dollars towards that. And however, that could work versus I appreciate the city of Rio Dell, but I'm looking at something that would actually benefit. I'm sure I'm not the only one that has a lot of task force stuff going on in their district. So I do think that's really important.
And through the chair, if I may, the last discussion we had this last year, the sheriff really did give a fairly decent presentation with regards to the stats on what was happening with regards to those. And maybe we're not there today necessarily, but I'm just saying, it was impressive the amount of really, quite frankly, not just really hard drugs, but weapons that were removed as part and other sort of the violent tending behavioral incidences that were addressed as part of that. And so for me, my preference would be to if we're going to spend more money in terms of enforcement in those areas, that's where I would prefer that space to be. But again, I'm not hardcore. I've given my preference, and the board can do what they want with that.
Okay, and actually, I want to go to Supervisor Bohn. He is calling in on a number and did not press *9, but we are communicating that he would like to make comments, and so I'm glad that he's able to reach out through his cell phone. So, Supervisor Bohn, I'll ask press *6 to unmute, and then tell us your thoughts. Can you press *6? Oh, actually, you have to raise your hand first, I think. Press *9.
Virginia, are you trying to unmute me or something?
Oh, no. Oh, sorry.
Well, don't set me free. Don't do that. Be careful.
No, we're trying to get Supervisor Bohn on here.
Yeah, Chair Bass, I've unmuted all the callers, and
well, he's 0991, and
yeah, he just needs to push *6 on his phone to unmute himself.
Okay, now he says he's fine. So, Supervisor Bohn, if you want to still make comment, we'll be on this conversation for a couple minutes, I'm sure. Or maybe Ryan, do you want to?
I could call him on my cell phone and get him.
Yeah, that might work better. It's his work number. No, okay, no, he doesn't want to talk. All right, I give
Okay.
up. Okay, so we're going to go back to that list that we have. And
Alicia, can you make that larger, please?
And did we do something with the drug task force is what I would like to figure out how to, I would switch out Riedel for the drug task force. But obviously that's not enough to finish what we need.
You could, so you did currently have the excess going to roads, which was 62,000 and some change. So if we reduce that, then just takes it down to the excess of 3,994 to the roads. Would you like me to read these off?
Yeah, because they're still pretty small to see. And Supervisor Bohn obviously is not able to see.
Okay, I've got of the 799,333, it's proposed to allocate 200,000 to application number 10 for the Harrison Street project, 353,994 to application 17 for Public Works roads, 80,000 to application number 15 for Public Works illegal dumping, 7,600 to application 20 for the Garberville Town Square, 1,750 to application 22 for Access Humboldt, 10,000 for application 23 for New Directions, 7,900 to application 25 for CERT training, 46,100 for application 26 to 211, 33,488 to application 8 for Rio Del. Excuse me, that's the wrong application number for Rio Del. I'll have to update that. And 58,498 to bring whole the Fortuna DTF application.
So I was saying to switch out Rio Del, but you're saying we could do it both?
The original proposal was give anything left to roads, and so that would allow you to do both and just give a smaller portion of almost $4,000 to roads.
Okay, well, I'll see what the others feel about that. Any comments on what we currently have up there?
So, Alicia, so that would be
Bushnell.
The public roads would still, with funding Riedel, would still be 353,000 to
almost 354.
Okay, and okay.
Well, Alicia, the drug task force is only getting 58,000. Is that the deal?
That's the remainder. Of their application left. Yeah, they received 103,937 through the budget process.
I have to say this process is much easier to do when we're all together in the chambers. Man.
Yeah, it's nice having that big screen.
Can you, I'm sorry, Alicia, can you go back to the line item screen? Thank you.
And then Supervisor Wilson after Supervisor Bushnell.
I'm good, thank you.
All right, thank you, Supervisor Wilson.
Yeah, I mean, I think this is probably all right. Although, I mean, there's nothing wrong with having, we don't have to spend every penny. I mean, every time this comes up, this can roll over, and we can give it to the community advisory committee that we constructed for that purpose. So this is why, again, I kind of kind of shy away from these very geographically specific spots in this way, because now what it's going to do, is like other smaller organizations or in other communities are going to be like, well, wait, where's ours? And I just I just feeling it. We're gonna see it and hear it. So, but if this is where the board wants to go, I'm okay with it.
Supervisor Wilson, I know that you had brought up the smaller amounts, and so I think that's part of the reason why some of these have been added in here. If you were to have your druthers and not have something that's so specific, which ones would you think we might want to consider not including?
Well, I mean, I think I'm saying, here's the thing. It's like, I'm a big supporter of the Garberville Town Square. I mean, I just personally, I think that was a huge advancement for the town of Garberville. And I think that that's really, really important. Okay, that's me. And I believe that also Rio Dell does have the need for moving forward with, getting somebody out of the clerical thing and into the streets and, of their community in terms of public safety. Nonetheless, those are the two, besides the Rhodes and Harrison's, those are the two that are very specific. But as you pointed out, Rhodes and Harrison, the Harrison Street is 3 districts, which is not District 2, right? So in that way, I'd say, okay, but going back to, fully funding the drug task force, I don't know, I'm just going to be talking in circles, but you hear what I'm saying. I just feel like this is where I don't know. I'm fine. This is why I always want to go all the roads, to be quite frank, and have it be subdivided in that space. But nonetheless, I'm okay with this. If the motion maker wants to move forward with it as it is, I'm gonna stop talking about it, and hopefully we can go on to something else.
In just a moment, I will go to the motion maker. I still want to reiterate my belief that the drug task force is countywide, even though it says it's for Fortuna. I do think that I feel a little less that is specific, but I get because of how it's being asked. It is. Sounds that way. All right, Supervisor Madrone, are you going to amend your motion, or what are your thoughts?
Oh, I believe we do need to amend the motion to add this detail at one level or another, and I'm more than willing to do that. I appreciate the conversation. These are always difficult things. I do agree that in general, we ought to be supporting projects that are countywide, but there are very important projects that happen in districts, and I recognize that. If we go ahead with this list as it is right now, there are 3 projects in District 2, 1 project that's District 1, 3, and 4. All the other projects are countywide. I guess you could say New Directions is, basically they do their work from Fortuna to McKinleyville, so there are multiple districts as well. So there's really no District 5 specific project here, or District 4 specific, other than Harrison and the corner there. So, that becomes problematic because Supervisor Wilson's right. We all get pressure from our constituents. Well, why didn't you fight for the proposals in your district, and stuff? And so that does create a bit of a difficulty for me as far as trying to proceed. But I think we're very close. It seems to me that we're probably in close agreement on this entire list, except should we fund both the Fortuna Drug Task Force and the Rio Dell clerical positions and reduce the road budget or not. And I'm just wondering, my preference would to keep as much money in the road budget as possible, frankly, because that benefits the entire county. So I guess I'll just ask a quick question as Supervisor Bushnell, and then I would be prepared to go ahead and make an amendment. But Supervisor Bushnell, of these 3 projects, Garberville Town Square, Rio Dell Clerical, and Fortuna Drug Task Force, although the point has been made by Supervisor Bass that task force is countywide. So, you know what? Let's just go ahead and go with this list as it is. And perhaps in the next round next year, District 4 or District 3 or something else might get a little more consideration for their projects because of the way we're doing it today. So I'm fine with this. So I will amend my motion to include the following funding recommendations. $200,000 for the Harrison project. I don't have the proposal numbers in this list, but I think we know what we're talking about. $80,000 for the county illegal dumping. $7,600 for the Garberville Town Square. $1,748 for Access Humboldt. $10,000 for New Direction. $7,900 for the CR CERT effort. $46,100 for the 211 effort. $33,488 for Riodell for the clerical assistance. $58,498 for the Fortuna Drug Task Force, leaving a balance of $353,994 for the road fund.
996. I was off on the.
Oh, great. Okay. All right. Good job. 96. And I assume Alicia was following and checking the numbers on all that. So I would make that my amended motion, along with all the other details of the staff recommendation.
Okay, and that was including not to have budget
That's
briefings,
correct.
I mean, by the departments.
That's correct. We'll do that next year. Take the stress off.
Supervisor Wilson is the seconder. Oh, I'm sorry, Alicia.
I just want to thank Supervisor Madrone for seeing the broad picture. I really appreciate that.
Okay, Supervisor Wilson, does that second, or do you second this amended motion?
Yeah, I will, but I will also note that, you know, the third district's share of the road, the Harrison Road, is very minute in terms of, I mean, my constituency is not like, it's just a very slight corner. Not to just, you know, not to put
Mine's
down
even less.
or devalue those third district residents that live in that corner. They're all very, very important, but to understand that it's like, yeah.
I hear Supervisor Bohn on now, so let's catch him while we have him.
I don't know, I didn't know, I've never done this where we kept score. I've always known the first district does. I didn't know we had a first district. Supervisor Jones said we had something specific in the first district. I wasn't sure what that was, but I kind of agree with everything, but I think I mentioned it earlier. Is there any way we could allocate, is there any way we can get in the earlier report, since it's still on the same item, it didn't get much of a comment, and I guess it's not anything. We lost $505,000 in road funding due to our indirect rate cost proposals not being put in on time, and now I'm trying to figure out exactly how that happened, and I'd like to get that from Director Matson, because if we're going to let $500,000 slip away and then have to give them more out of Measure Z when we could be funding Riodell, town squares, you know, and our drug task force officer, and that is specific. The reason that was funded 4 years ago was Fortuna at the time hadn't passed their budget, or hadn't passed their indirect funding, their tax measure. And they'd put somebody on the drug task force, and then they would be taken off the drug task force because they needed to put them on the streets of Fortuna for public safety. So with that being said, and the returns on that have been immense, because you have somebody on the ground talking to the guys in Fortuna and then bringing it back to the task force. And I want to thank the sheriff and the new head of the drug task force, Matt Tomlin, for putting as much time. As Mike Wilson said, the guns and the hard drugs and everything coming off the streets are immense, and they're doing yeoman's work. So I can support that, but that's where we got funding that, and it's been very successful for the residents of the Eel River Valley. I don't think it's Fortuna direct. I think it's the Eel River Valley, kind of like the school resource officer covers Riodell, Ferndale, and all that too. So, I again, roads are a big issue, and public safety, but I'm good with the way it's headed. I'm still a little worried about the $505,000 we lost, and we didn't even talk about it.
Director Madsen?
Yeah, I can touch base on that. Our indirect cost rate proposal relates to our overhead expenses when working on state and federally funded capital projects. And so each capital project has to come to completion. And as you had on your agenda for consent today, you accepted 2 projects for completion. That sets off the final billing timeline of 18 months. We have to do all the billing and complete all the billing on that project within 18 months. And that has to mean that our ICAP, our indirect cost rate plan for the year, has to be approved for us to include it in the billing. If it is not approved, we can't include it in the billing. Well, it's dependent on the county budget closing and the county audit, as well as the cost allocation plan. And so, the timeline becomes critical for projects we're closing. For the projects you close today, but by the time we get to the end of the year, you've already lost 6 months of the 18-month billing time before the closing process for the year can even begin. And so the issue is having all of those ducks in a row, because I can't hold up on closing projects, because that would be basic. We wouldn't be paying our contractors. We would be possibly accused of defrauding the federal government and not properly closing. So the issue is having everything done all the financials for the county done in a timely manner, and then the ICAP comes afterward because it depends upon all of those. Then it has to be submitted to Caltrans. And so the other issue is you can get an extension. However, because our financial reporting has been changing, that precludes us from getting the extension. So I can't use the prior year's ICAP for the projects I'm closing in the current year. I have to use the current year, and I can't get the current year approved until everything else is closed. So it's not a simple issue. It requires multiple county departments working together. We're working closely with the auditor on this year to hopefully get it done and closed and our ICAP approved, so that projects like you closed today and ones that we did over the summer, we can get reimbursed for our full funding.
Thank you, Director Madsen. Supervisor Bohn, did you want to add some more? And then I'll go to Ryan because his hand is up, probably for clarification of the motion.
No, it just seemed to me we lost $500,000. That was okay, and I guess it is. So, all right.
All right. Thank you, Rex. Ryan.
Thank you, Chair Bass. I'm pretty sure I have the motion before I would like to read it out if possible, and if we're at that point.
Just give me one moment. There is someone that called in as an attendee. I don't have a name. I don't know if it's a public person because public comment is closed on this item. So if the person who has the number ending in 2734 is a county department head or, well, the only supervisor we have, then you can go ahead and talk. But if it's a member of the public, you can't, there's no more comment on this item. All right, so it must not be a department head. All right, so then we'll go back. Yes, Brian, will you please summarize what you believe was the intended motion?
Thank you, Chair. They actually did unmute themselves.
Oh, did they? Thank you, Ryan. Excuse me. Now, who's on? Who's this on the phone?
Can you hear me?
Yes.
This is Ernie Branscombe. I'm the member of the committee, advisory committee for Measure Z for the 2nd District.
Okay, so hold on, Ernie. Because it's you and you are on the committee, I will consider you as part of our conversation. So please go ahead.
No, the only thing I wanted to say is the committee spent a lot of time prioritizing these things. We made numerous phone calls emailed, texting, and researched this quite thoroughly. And we prioritize things fairly all the way through, clear to the bottom of the list. And it's, you know, I respect the Board of Supervisors' recommendations, but I want them to consider that we did prioritize those with a great amount of detail. And that's really all I wanted to say. Please consider that.
All right. Thank you, Ernie, for calling.
Through the chair.
Yes, Supervisor Bohn.
Yeah, and in the years past, I know that there's been some dismay when we've gone off the chart with all the work that the Measure Z. And I don't think when we're talking about this, I think we need to thank the Measure Z committee for everything they do, because again, that's another volunteer group that comes in, meets, used to come in and meet. So I want to thank them. I especially want to thank Ernie. He's been around there a long time. And this is one of the concerns I had, is to cherry pick all these. And these guys have about 20 hours in meetings, and we're an hour into it, and we've got it all fixed. So I think Ernie speaks very loudly on this, and probably the reason it's not the reason I don't like any of this stuff. It's just, I remember past issues, Measure Z committee gets pretty not put out. I mean, they're just giving us recommendations. That's why they're here. But we need to have pretty solid reasons why we're doing this. And it's not just because it's in 1, 2, 3, or 4, or 5. It's the betterment of the county is all, and the presentation that was it. And you got to understand, we're not looking at the presentation, and that has a lot to do with it too. So thanks, Ernie, for calling in and reminding us of that.
Yes, and thank you, Supervisor Bohn, for bringing that up, because I saw a lot of nodding heads when you were talking. Supervisor Wilson?
Yeah, I concur with that that reminder, because we've been doing this for a while, and sometimes we forget that the Measure Z committee does a huge amount of work, is extremely transparent in its process. It's the reason why our citizens voted twice to support Measure Z. It's unique in the state in terms of its transparency, where, you know, why we tax ourselves, and then we create a transparent process by which applications go in and citizens review that, and within this process, and then that money's expended in this what we're doing today, transparent way. And I wish we could do more of that, to be quite frank. This is how communities, you know, again, tax themselves and reinvest in themselves. And this is appropriate and good. And I want to say that the Measure Z committee is absolutely essential in that. And thank you so much for all the work that you guys do, because it is hours and hours of work. And to what Supervisor Bohn says is, sometimes we start our conversation with just what your point is, which is, hey, we've got this committee doing all this work, which is why I said in the beginning of this discussion, and we oftentimes get dragged into kind of picking it apart and all this stuff. What we could do in the future, should we want to, is just roll that money back over into the Measure Z committee and let them do their job without our influence in this space. That's one option. But we're here today. And this is where we are. We have this little conversation, and I'm happy to move forward with the way it is right now. Although I would say that, you know, next year let's really think more about that, and hopefully we can always iterate towards better. Thanks.
All right, Supervisor Madrone.
Thank you, Madam Chair. Good discussion as always. You know, I too very much value the work of the Measure Z committee, and last year they actually came to us with a recommendation that we did not act on, and that was their suggestion that maybe there needed to be a cap on the fixed funding out of Measure Z, which, you know, if there's $10 million, about 70% is going to the fixed cost and the Sheriff's Department, DA, DHHS, et cetera, which basically means that the amount of money available for the discretionary projects is being reduced every year. And so staff gave us kind of a scenario of how that looks. And there was a suggestion in that scenario that it might take many years to get to the point where it's reduced significantly, but it is still an issue, and we've kind of left it to the future. But more importantly, I think, this was brought up last year too, perhaps by you, Supervisor Wilson, that perhaps the board could suggest to the committee that there be a small grant set aside out of this money so that, because what we're doing is we're seeing these grants for $5,000 or $10,000 compete against requests for $500,000 or $250,000 or other things. And it just, I'm just wondering if we set up, say, $200,000 out of the Measure Z funds for a small grants program for requests of $20,000 or less, then they could then compete against each other per se in that small grant world, leaving the rest of the larger picture. So just a suggestion. It's not really on the agenda here today. So I appreciate all this discussion, but just thinking, would that be something that this board might support down the road? And perhaps we ought to have a discussion with the Measure Z committee on those kinds of changes that we might consider later, but not here today. So I'm ready to go ahead and vote on this when.
All right. Well, let's see if what Ryan has for the motion.
Thank you, Chair. If this is what I have, is I have to approve staff recommendations, postpone the department budget presentations for a year, approve the carryover of Measure Z funds into fiscal year 2020-2021 for the following projects: $18,259 for KMUD, $127,882 for the Orleans Volunteer Fire, $17,155 for the Measure Z audit, and $364,208 for the fire chiefs to complete remaining projects, and then to allocate the remaining Measure Z funding to the following applications. And that was application number 10, Roads Harrison, for $200,000. Application 17, Public Work Roads, for $353,996. Application number 15, which was the Public Works Dumping, for $80,000. Application number 20, the Garberville Town Square, for $7,600. Application 22 for Access Humboldt for $1,748. Application 23 for New Directions for $10,000. Application 25 for the CERT for $7,900. Application 26 for 211, $46,100. Application number 12 for the Rio Del clerical position, $33,488. And lastly, application number 8 for the Fortuna DTF for $58,498.
Small clarification, if I may, through the chair.
Yes.
Ryan, Rio Del is application 8 and Fortuna's application 7. And can you confirm the amount you had for the roads?
Yeah, Rio Del was what, Alicia?
Application 8.
Okay. And
Fortuna was application 7.
7, Fortuna, thank you. And roads was application 17, Public Work Roads. I have $353,996.
Perfect. Thank you.
All right. So is the motion maker agreeable to that?
So,
Yes.
Yes,
Supervisor
Bohn? Yes. Go ahead, Supervisor Bohn.
So Elder and Vulnerable Adult Services Team from DHHS and the Adult Protective Service and the District Attorney are not getting funded. Number 12. I heard 12 called, but I didn't hear the.
No, 12 was not funded, Supervisor Bohn. That was a discrepancy in the application numbers for Rio Del and Fortuna.
And then no funding for waterfront recovery. Am I reading that right too?
Correct.
Thank you for bringing that up, Supervisor Bohn. I did want to ask Alicia, now that the drug Medi-Cal stuff is up and operating now, I wasn't, because I've always been supportive of whatever we can give to the waterfront recovery, but I'm not sure if the need is the same since the drug Medi-Cal kicked into gear.
Yeah, that excuse me, through the chair again, and then security guards for the Eureka main branch. I mean, when is the main branch going to be reopened? But are we going to do away with that? Because I don't know if anybody goes by there. Quite a hangout. So, I don't know. I just think we're taking so much of this away, and this is from April. So I mean, I don't know what's changed. I like the idea of the Measure Z committee working on this again, because I don't have the applications, but we're financing we're actually financing all the way down to the last 3 of the last 5 out of 27. So not saying that they're not all deserving. Everybody's deserving, but actually 4 of the last 6. All right. It's not that I don't appreciate what you're doing in the time and putting this all out there, but I can't support this with knowing the Measure Z put in so much time to ranking these things and we just tossed it out the window.
Thank you, Supervisor Bohn. Any other comments at this time before we vote? Supervisor Wilson?
No, I appreciate what Supervisor Bohn says with relationship to his discomfort.
I think we all can understand that. All right, Ryan, will you please do a roll call vote?
Chair. Supervisor Madrone?
Yes.
Supervisor Bass?
Yes.
Supervisor Bushnell?
You're muted.
We can't read. No reading of lips today.
Yes, sorry.
Thank you. Supervisor Wilson?
No.
No. And Supervisor Bohn?
No.
Through the chair.
Yes, ma'am.
Point of clarification, that does not give us a 4/5.
Right, I was going to ask.
Okay.
I was going to ask about that. And Supervisor Wilson, you just raised your hand.
Yep, I'm willing to change to my vote to yes in order to move this forward.
Okay.
And I'll let Supervisor Bohn keep his vote of dissent.
All right, thank you.
I'm used to it.
Thank you. So the motion passes 4-1.
All right, and thank you all for that conversation. And we're going to power through this next one, which is actually the item pulled from consent, and then hopefully we can take a brief break before closed session. So this item does come to us. It was pulled by Supervisor Madrone. So would you, the floor is yours to explain your reasoning.
Yeah, I believe that staff have a presentation prepared for us to answer some of the questions that came up from the Auditor Controller's Office. So I think that would be the best way to proceed, and then we can have a discussion.
All right.
So through the chair, I would introduce Scott Adair, our Economic Development Director, to walk your board through the presentation. Scott, are you there?
Yes, I am here.
Marvelous.
Can you hear me okay? My audio coming through okay?
It's a little weak.
I can get a little closer here. And I can talk louder. How is that?
I think that's better.
Okay, perfect. Well, hello, Chair Bass and board supervisors, and also staff and members of the public. My name is Scott Adair, and I am the Director of Economic Development for Humboldt County. And I lead and administer the economic development staff and programs and initiatives which come out of our office and which fall under the purview of the County Administrative Office. I am appreciative of the opportunity today to share more information with regards to this particular agenda item. It's my understanding that there may be varying opinions for this particular item and the amendments contained therein. Throughout the process, our team engaged in what I believe to be fruitful conversations with county council, also the county administrative office, and as well as the auditor controller's office. It is my hope today that I can provide you and your board a presentation with factual information so that you may take that information coupled with other insight that you may receive from county council or the auditor controller to make the best policy decision concerning this item. So that said, I'm going to go ahead and share my screen and move forward with the presentation. And are you able to see my screen? Perfect, wonderful. So this presentation is concerning the amendments to the agreements that existed previously between the County of Humboldt and Shasta County Private Industry Council, also known as the Smart Business Resource Center. I'd like to add a little bit of background and give your board a little bit of perspective on what it is that Smart Business Resource Center does for the county. And I think this will be helpful to your board as you take this insight into consideration and look to make a decision concerning this item. SMART, which was previously known as the Private Industry Council, is a 501c3 nonprofit agency with the County of Humboldt has contracted to provide services to subrecipients or Humboldt County residents who are job seekers to help those individuals find jobs, increase training, skill sets, aimed at increasing their earnings and finding gainful employment. SMART does serve other regions besides Humboldt County, including thousands of students and job seekers, schools and government agencies and employers throughout the North State. In Humboldt County, the Smart Workforce Center is located in Eureka. You may be familiar with it. It's at 409 K Street. And their facility, that location, provides services to Humboldt County's full population of 135,000 residents. The services available to subrecipients through SMART's program include assistance in filing unemployment claims, programs that can help residents to get reemployed or pay for education and training, even as specific as providing transportation or interview clothing, tools or equipment for individuals so that they can secure employment. The relationship with SMART does extend beyond simply just the services that are provided on behalf of the county to subrecipients in our community. SMART has also contracted with DHHS to provide contact tracers and communicable disease investigators in order to help the county in its effort to mitigate the pandemic and to slow the spread of COVID-19. SMART is also currently engaged in discussions with EOC leadership, and they're exploring providing staff support for EOC operations and other COVID-19 mitigation efforts, in addition to those contact tracers that they provided to DHHS. And I share this only so that your board understands that the SMART services to subrecipients into the county as well are directly related to job loss and directly related to economic hardship caused by COVID-19 and also the county's efforts to mitigate that crisis. That's a little bit of a background on who SMART is and what are the services that they provide to the county and also to the subrecipients. Now, to talk a little more specifically about SMART and previous service agreements, your board previously approved professional service agreements with the Smart Business Resource Center to provide workforce development services using funding which is offered through the United States Department of Labor and State of California, their Employment Development Department. And these services are defined in a multitude of agreements which date back to July of 2019, and I've listed those agreements in the presentation here for you. To give your board a little bit more clarity with regards to the timeline of the activity concerning these amendments, we've put together a graph here, or a graphic, to illustrate the steps that staff went through with regards to moving these amendments forward for full processing, review, and approval. It began in October. On October 22nd, 2020, staff received correspondence from SMART raising concerns over late payments for services provided. On November 3rd, SMART also engaged board members directly of your board to discuss those same concerns that were detailed in the October correspondence. So after receiving that correspondence from the vendor, staff began to explore solutions to alleviate those concerns and to ensure continuity of services. There was information shared with us by the vendor that if the payment issues were not resolved, as well as other concerns they had regarding expediting contracts quickly, that vendor believed that they might have to withhold or altogether cancel services to Humboldt County and to Humboldt County's recipients. So our office worked with SMART to engage in contract amendment negotiations directly with the vendor. And during that negotiation process, we reviewed those documents with County Council, actually on a number of occasions. And once we came to an agreed upon document that fulfilled the needs of both parties and received approval from County Council, we moved those agreements to our County Administrative Officer for execution. After execution, in discussions and communication with the Auditor Controller's Office, it was identified that perhaps these documents actually need to be taken back to your board for approval or for ratification, and that there were some concerns about some of the payment terms which were structured in the agreement. So our staff took these concerns seriously and under advisement, and took that guidance back to further discussions with the County Administrative Office and their team, and also with County Council to go over those concerns that were reported by the Auditor Controller's Office, and then incorporated changes to the process, which includes bringing these items back to your board for ratification. The proposed contract amendments, they are adjustments to the agreed upon payment schedule to allow for weekly advance payments with a year-end settlement process, which staff has discussed with the vendor as being potentially a monthly true-up or reconciliation or settlement process. The proposal is intended to allow for continuity of services following the written communications that we received from SMART, indicating their concern about delays in tendering payments, and information that they shared with us that those delays were causing financial adverse impacts on their organization, their agency. It's important to state that there are some examples that do exist of advanced quarterly payments made to other organizations. For example, in fiscal year 16-17, your board approved advanced quarterly payments to Neyland Volunteer Fire Department, who received Measure Z funding. There are also other examples from DHHS of contracts that either have language for or not documentation, but language concerning advanced payments for services. And I can also share that in our dealings with vendors, Oftentimes, prepayment for a down payment or a percentage of payment paid in advance for services is relatively common. And I understand that there may be some other examples that we could share with your board today, and we have other staff available who may be able to share some of those other examples with you. The proposed contract amendment detailing or concerning the weekly invoicing lays out a payment structure wherein contract payments would be made weekly to SMART for services that they are providing to the county. Staff is certainly receptive to seeking guidance from the auditor controller on what that format could look like. And we are also working with the vendor on what perhaps a monthly itemized invoice process might look like, or a true up or reconciliation that could occur prior to any cash advances. Of course, a year-end reconciliation into a process would also occur. This is something actually required not just at the county level, but through WIOA and our partners at EDD. These programs are monitored very closely, and there are very strict reporting and auditing requirements as far as tracking and reconciliation is concerned. I can share also that advance payments to a nonprofit for services with a reconciliation at the end of the year was found by County Council to not be a credit or a loan of the county in aid of or relief or aid of or aid to an association, pledging the credit for payment of liabilities or making a gift of public money or a thing of value. However, I do understand that our auditor controller, who's with us today, may have a difference of opinion on that matter. And in the spirit of giving your board all of the information and insight necessary so that you can make the best policy decision, we do have County Council staff also available on this call who can provide additional insight if your board has questions with regards to the constitutionality of making advance payments to vendors. The amendments themselves have been reviewed by County Council. It was identified in Resolution 12-100, which provides authority to the CAO to execute documents so long as they're related to activities or programs in the areas of economic development, workforce investment, headwaters, administration, etc. Staff reviewed the proposed amendments and then subsequent changes throughout the negotiation process with County Council on a number of occasions, including reviewing and having more discussions with County Council once we received advisement and guidance from the Auditor Controller's Office, which laid out some of their concerns about the agreements. It was identified in Resolution 12-100 that the CAO did have that signature authority. Staff has also had discussion internally as to whether or not the authority to execute these agreements by the CAO could perhaps also be related to the previous authority given by your board to the CAO to execute contracts which are related to COVID-19. Our staff is recommending that your board receive and ratify the attached amended professional service agreements. The agreements that we attached and uploaded to the agenda item were executed by the CAO. However, they're lacking risk management signature. That was an error. I can share with you that risk management has executed the agreements as well and reviewed them. So we do have those copies. In addition, our staff recommends that not only your board approve these amendments, but that your board determine that modifications to these agreements would serve as a public purpose to ensure the continuity of services, especially during an economic crisis in the COVID pandemic, and that the county administrative officer or designee be given authorization from your board to execute subsequent or future amendments to these agreements. Before we move on to questions, I would just like to state and reiterate that during this extreme economic crisis, which has been very detrimental to the business community. Our office remains very passionate about helping and assisting businesses in the business community. We understand that this is a medical crisis and a public health crisis, but it's a crisis of livelihood as well. And many individuals' lives have been adversely impacted by the adverse economic impacts on those businesses and employers and employees because of COVID-19. As a former business owner, this is very important to me personally, but also I'm not alone. Our team has background and expertise and perspective, which leads to the enthusiasm for helping the business community. I only say that to add insight that whereas our office strives to be business experts, we remain receptive to guidance and direction from your board for improving communication and processes as we bring before your board items and initiatives and programs which come out of the Office of Economic Development. That said, staff is available today, not just myself, but also Ms. Alicia Hayes, Assistant CAO, is available as she was involved in the process, and County Council is also available today to address any other questions that you may have, either concerning the contracts or the amendments themselves, or perhaps the process that we went through, or some of the concerns and guidance that was received from the Auditor Controller's Office. Thank you very much.
Thank you, Scott. And what I would ask is, can you stop sharing so we can get all the faces on? And I see Supervisor Madrone has a question or comment.
Yes, thank you, Madam Chair. First of all, I want to thank staff for their incredible work in these hard times. Director Adair, Economic Development Director Adair has, him and his staff have been just doing an amazing job working with our small business community. So as always, I want to thank you for that. And I appreciate the communication process that has been ongoing with the Auditor Controller's Office and CAO, et cetera. I also appreciate SMART's help. They clearly are a very important player to us here in Humboldt County on many levels, not only the current work that they're doing for us, but also the potential that they might even help us with more. So I value that relationship very much. I appreciate this being brought before the board. There were 3 concerns that had been raised by the Auditor Controller's Office. One of them was that these contract amendments needed to be approved by the Board of Supervisors because they're over $50,000. And so I appreciate that that's exactly what you're doing here, is bringing this forth to us to review and approve. And so that takes care of one of those 3 items. The other 2 items, one of them was the issue about cash advances. And, having worked in nonprofits most of my adult life, I know for a fact that there are many nonprofits in Humboldt County that do work for the county, whether it's through the North Coast Resource Partnership Program, doing watershed restoration, job creation, salmon restoration, or many of the other programs that the county partners with nonprofits on. And many of those groups really don't have any money in the back, and cash flow is a nightmare for them. And when payments from the government can take 90 to 120 days to come in from various grant sources, not necessarily the county, but from the state, the feds, it puts a huge burden on these nonprofits. And there have been many requests over the years to provide them with advance payments that have never really been approved in that arena at all. You did mention a couple of examples, but I will say that the need for advances is far greater than what we have responded to. This is a very large organization providing services to all kinds of entities around the state. And I would hope that they would be in a position to where they had the kind of resources to be able to manage their programs, and et cetera. But nobody can manage late payments when they come so late that it delays things in a serious way and affects your cash flow, your payroll, because no matter what, we still have to meet payroll, nonprofits and other groups, regardless of what your cash flow is. So lines of credit come into play and all kinds of other things. So I understand that. But for me, this issue of cash advance really ties back to the biggest concern that the Auditor Controller's Office had, and that was that they have denied a number of invoices in January that simply did not provide them with the kinds of backup documentation that they were requesting and requiring to be able to account for the invoicing and to bill for it. For instance, many of the bills were coming in with these flat dollar amounts that were actually hitting to several different purchase orders. And, you know, accounting is really important, right? So if, you know, the reason that their payments have been delayed, let's be really clear about this. It's not that the Auditor Controller's Office is just sitting there going, I don't want to pay this, I'm going to delay these people. That's not what's going on. The Auditor Controller's Office has told this provider that they need to provide the detail in their invoices. They need to say, X amount of dollars were spent in payroll on this purchase order at this time, et cetera. And they need to break their invoices up so they attach them directly to the individual purchase orders, et cetera. The detail needs to be there. Detail matters. I mean, this is to the central core of this conflict that's been going on between portions of the county and the Auditor Controller's Office. They're simply asking to be provided with the detail that allows them to account for that invoice to be accurate and allowable under the contract, and then they make payment on it. Does that mean they make payment tomorrow? No, they get to it as soon as they can. And with new staffing, they'll get to these things a lot sooner than they did in the past. So this problem of late payments for this provider has now morphed into giving them advance payments. And, you know, for me, it's like, well, wait a minute. They can correct their own problem. If they would simply submit invoices to the county that actually fairly documented the expenses in the detail required by somebody at our end looking at it and going, wow, that looks good. I can see these dollars came from here. This money was spent there. This time was spent here. That's what accounting is, right? So I don't see that this thing in front of us here today does anything to solve the problem. The problem is that the provider has been told what they need to provide to get fast payment on their invoices, and they haven't been providing that. So simply giving them an advance to be rectified each month or at the end of the year is only going to compound that problem into a nightmare. You know, every provider needs to provide the detail that is asked of them to support the documentation that the county is paying for things that they should be paying for. So that's my real problem with this issue. And the reason that I pulled it, I just don't see that we've actually resolved the problem. What we need to say is, SMART, you need to do a better job of submitting invoices with the detail requested, and we'll get your payments promptly. It's that simple, you know, and I just don't understand why we're trying to bend over backwards for them and allowing them not to do that. You know, any provider that's not willing to provide that kind of documentation and detail, why would we want to pay that invoice? So that's kind of where I'm at on this. I think you get.
We get it. I think we get the gist. But you brought me up a question that I'd like to ask. I guess if we go to Scott. So how long have we been, a couple questions. How long have we been working with this organization? Or is that Amy?
Well, through the chair, I think Assistant County Administrative Officer Alicia Hayes can address some of these concerns that have been brought up.
All right, thank you. So Alicia, I did want to ask for myself though. I'm curious, how long have we been working with SMART?
Scott could probably confirm that better, but I do believe 2017, 18 was the first fiscal year. They are, you know, relatively newer to the county. I believe we were providing services through EDD prior to SMART. And Scott, please confirm my recollection of details on this. But speaking to the issue on the...
Can I ask you my last question, then I won't ask anymore. It's if, did we have this problem at all in the first years of this with problematic invoices? And then that's my questions that you can respond to.
I would defer to Scott to speak to the history on the payment processing of invoices. And Scott's staff has had some turnover in their administrative components. So Scott, can you speak to that?
Yeah, I can happy to address a few of those questions which came up, Chair Bass. So we've been engaged in a contractual relationship with Smart Business Resource Center for a number of years, dating back to at least 2019, wherein the original contracts for which these amendments are being presented today were executed. They are a relatively new agency, however, who we've worked with. They do, I am not aware of any previous payment issues or concerns, at least that have been raised to me or discussed with me by staff or by the vendor. The first time that we were made aware of the concerns concerning payment issues was just prior to the October 22nd letter, wherein it was communicated to us by the vendor that they were going to be remitting that letter. I can share that subsequent to that letter, our office had communication with the Auditor Controller's office to improve communication concerning the processing of invoices. I also spoke to the Auditor Controller, or I have spoken to the Auditor Controller directly about this particular issue or these particular amendments or contracts, and have communicated that we remain open and receptive to ways to improve that process. But the funding situation with the vendor directly, from what I understand, even though they may be well funded and well capitalized for other programs and other projects, they can't mix dollars for programs. So only revenues and dollars that they receive from our county can be used toward expenditures and staff and personnel for programs related to Humboldt County. Therefore, if they're not receiving payments, even though they may have other revenues, they can't rely on those revenues for programs and services for Humboldt.
And if I may, through the chair, speaking to Supervisor Madrone's point on the invoice detail, prior to the movement to a cash advance payment system, the invoice appears very detailed to me. I've got one pulled up here from May, and I'm happy to share it with your board if you would like to view that. But it's broken down by each program. There's 5 different program areas, and it breaks it down by the type of program activities that they're doing, and broken down into about 10 different categories from there. When we move to the cash advance, that high level of detail on the cash advance isn't available at the time of the advance, but SMART will be issuing a month-end detail to reconcile those balances. So the documentation that was submitted to the Auditor Controller for the cash advance details out the amount being paid to each particular contract and is in coordination with the contract language. That being said, our staff are more than happy to work with SMART, and SMART has been incredibly accommodating and willing to maneuver systems on both of our areas to try to make this relationship meaningful and beneficial to both of our agencies. So we can certainly revise that statement process in any way that meets the auditor's needs in substantiating the cash advance requests.
Thank you, Alicia.
Through the chair.
Yes, I was gonna say, any other supervisors? Supervisor Bohn?
Yeah, Alicia, SMART does not submit the bill directly to the Auditor's Controller's office, don't they? And maybe I'm wrong, but don't they do like everybody else? They submit it to the Economic Development Department, and then they categorize it, approve it, and then send it on to be paid. Is that not correct, or is that?
That is correct, Supervisor Bohn. The invoice is submitted directly to Economic Development. They evaluate it for accuracy, and then approve it and send it on to the auditor controller at that point in time through finance enterprise.
Because it's their program and they fully understand the, okay. I'm just, all billing goes through the respective department heads before it's paid, right?
By and large, yes.
All right, thank you.
And Supervisor Bushnell.
Thank you. I have a general question for Alicia, for my understanding, or possibly Scott. So when, is it specific, does it say specific somewhere when, Scott sends this on to the auditor controller to be paid, and Scott has approved, he has looked at the invoice and approved what the invoice says. Has there ever been more documentation needed than that?
Well, I believe we've only gotten through the first month's worth of cash advances. So it stopped shortly after we started this mechanism of payment schedule. And the auditor controller did ask for a month-end reconciliation process for the December payments that were issued. And Scott, you can speak to if that has been provided or will be provided, but I do know conversations with SMART have taken place and they're happy to provide that documentation, again, in whatever format meets the auditor controller's specifications.
Through the chair, yes, Alicia is correct. We've had that discussion with SMART after receiving that guidance from the auditor controller's office that we would likely need to ask for that additional level of detail, and they've agreed to provide it.
So at this time, then we're just waiting for them to provide that information, knowing that the auditor controller's office is requesting more information. So we're just wait. That is forthcoming, correct? Can I just assume that?
That is forthcoming, yes. However, payments at this point have stopped. Scott, can you speak to how many we have not been able to get out the door at this point? I think it's 2 or 3 maybe since this issue arose and we began developing a staff report to bring to your board.
I don't want to speak for the auditor controller's office. I believe the auditor controllers on the call could provide additional information. However, what I can share is that the auditor controller's office did process one of those advance payments to this vendor before it caught their attention that they had concerns about this particular payment process for this vendor. After that, their office reached out to our office with the way that the process works. When we submit an invoice, after we review it and approve it internally on our side, then it's entered into the system and goes to the auditor controller's office for review. And then they can reject an invoice if they think that an invoice is not ready for processing, and they can include notes with that rejection. And we received a rejection on one invoice. That came back to our office for review, and then we engaged in discussion with team members from the auditor controller's office about that rejection to see what would be needed so that we could advance that invoice further for processing. And then subsequent to that, another invoice has been received by our office, but we've not processed it yet because of some of these issues which are outstanding. I think what is at question and is before your board today, and again, other parties who are here who may also have their own opinion, is not necessarily the processing of the invoice, at least at this time, but that the auditor controller's office feels or is shared that they don't feel equipped or able to make payments according to the schedule, the payment schedule, which is laid out in the contract. So that question is whether or not we need to modify that payment schedule, which staff can do. But the way that the item is worded now would not necessarily allow for that. I think there are also 2 other questions of concern which came from the auditor controller's office. The other regarding constitutionality of weekly advance payments, which we reviewed with County Council, but I know that the Auditor Controller also has an opinion or her own perspective on that. And then also the other issue of sequencing and approval and routing for these types of agenda items. I believe those are the three issues of concern that have come up from the Auditor Controller's Office, if I understand those issues correctly. So there are those issues to consider, and then there's just the actual contracts themselves, which have now been amended and executed by the CAO and by risk management for those critical services to the community during this economic crisis. As far as the payments go, though, we have processed one payment under this new agreement structure, but we've not processed any others.
Thank you, Scott. Can I ask one last clarifying question? Are we currently in the rears with this company?
Yes.
Thank you.
All right, any other board members that'd like a comment? Supervisor Wilson, and I'm not sure if the auditor cares comment. I see you're on there, so just raise your hand if you did at some point in time. And Supervisor Wilson?
I want to speak just to one element of this with relationship to the constitutionality. And I appreciate what Supervisor Madrone said with relationship to, you know, we don't have necessarily the same fiscal payment arrangement with every vendor. And that's true. Nonprofits and for-profits. I mean, that's what we have these contracts. Although we, you know, there are sidebars to that, for sure. And I do believe that, you know, from a legal perspective, we do have the ability to pay in this proposed structure. Quite frankly, because this is it's a public benefit nonprofit doing public benefit work. And so, I mean, as an organization, we can give out loans for those sorts of things too. I mean, you know, under approved structure. So I can see where one might, you know, take note that this arrangement may be something that other nonprofits have not been able to avail of. But nonetheless, I would say that we're getting into a space where I want to. There's like the programmatic and sort of policy end of this, and then there's the point of where we, as supervisors, start getting into micromanagement. What I don't want to do is go so far into that space. So that's kind of where I'm sitting here. I was like, where are we, you know, if we think it's legal, if we think it's appropriate, and we think it gets the job done in terms of delivering services to the community members that need those services, then that's kind of where my focus is at. And I'm not as prone to get into the weeds of that. And from what I can tell, the services being provided are functional and have done a good job. And I would like those services to continue. And if the legal arrangement if this arrangement is legal and we can account for it and deal with the issues of accounting to everyone's satisfaction, then I'm okay with it. What's kind of outstanding to me is like, is this really like a cascading precedent that's going to cause other issues? I guess that would be kind of my outstanding question for staff is, you know, are we risking some other issues down the road where fairness might be brought into play or something like that?
CAO Nilsson?
Through the chair, no, I do not believe this is a cascading issue. And I also know that County Council is on the line to just help reinforce the legality of what we're proposing for your board today.
Thank you.
All right, and did anyone from County Council want to weigh in?
Good afternoon. My name is Amanda Freeman, Deputy County Counsel through the chair. Yes, we did research this matter, and as staff shared, we are clear that this is not alone as prohibited by the California Constitution, and this is for a public purpose. The board determination that this is for a public purpose does take this squarely outside of the constitutional issues that were raised. We are happy to answer any more specific questions, but I think that should handle the overarching concern about constitutionality.
Any supervisors have any additional questions for Amanda? All right, thank you, Amanda. So if the board is okay with this, I would like to go out to public comment, and then we can continue our conversation after that. And we have, looks like one who would like to comment, and that would be Kent. Welcome, Kent.
Took a while, Virginia. Thank you for my opportunity to speak. I have to disagree with your CAO. If one group gets preferential treatment like this, everybody else would be able to request and hopefully receive the same treatment. I don't see what makes this group so special compared to all of our other vendors out there. It was kind of related that this was based upon COVID. So does a special agreement go away if COVID's taken care of? I noticed it was referred back to, I think they were started with us in 17, 18, 18, 19, something like that. I think that's when the $500,000 Rex keeps talking about wasn't applied for, we didn't receive for a grant, but that's a whole different issue. So I just really would caution you to move forward with this, having been an accounting major, and I'm sure Scott maybe was an accounting major, I don't know, Scott Adair, but the question we have about prepayment, does the county have anybody who prepays us without having submitted invoices? I mean, I doubt it. I know we're 3 years behind when Tom Madsen submits for FEMA for money and things. It's just a really strange thing to make an exception, and they were basing this upon having late payments. So it sounds like they're paid up current since one of these payments was already made, and with your additional staff to the auditor, as long as they prepare the right documentation and submit in the normal process, I would doubt whether they're going to have late payment problems, but that's just my guess. Sounds like I'm getting different messages from different places regarding their ability to submit exact things that are required. A lot of problems happen when these things are submitted to other departments and then forwarded. And so I just really question whether this is the correct procedure and precedent to set. So thank you for my opportunity to speak. And I guess I'll ask to be prepaid if I have anything to do with the county there. Thank you very much.
All right, thank you, Kent. And I see no one else lined up for public comment, so we will return to the board. And Alicia?
Yeah, I would just like to point out that we have developed prepayment schedules in the past. As Scott mentioned in his presentation, we did this in the 16-17 year with Neyland Fire Department for their Measure Z allocations in their stopgap funding for responding out of their district to Highway 299. Most recently in July of last year, we developed an advanced payment schedule for Redwood Community Services, who provides children's specialty mental health treatments. And that provides them with an advanced payment of $27,105 per month. So I just want to point out that there have been occurrences in the past where this has taken place. And this is just me doing a quick scrub of departments and my own knowledge in reviewing contracts that have come through agenda review. So I suspect there's others that I am not aware of that are in place.
All right, thank you, Alicia. And I did want to ask Supervisor Bohn if you had a comment, since I know you're on the phone and I don't want to accidentally miss you. Okay, not yet. Anyone else on the board wish to, yeah, Supervisor Wilson?
So if the board moves forward with this contract, it's still, I mean, these invoices in the format that we're talking about still get reviewed by the Auditor Controller's Office for approval and payment. I mean, that does not change. And whatever amendments are agreed upon with relationship to how those are done will get done, and we'll be moving forward. So for me, it seemed like the two issues were, you know, is this, you know, precedent? And I think I'm okay with that. I think, and with relationship to the constitutionality, which I also believe is been dealt with. So I don't know. I mean, unless there's something outstanding that I'm missing here. I mean, I appreciate this discussion. I don't mean to say that by not wanting to micromanage doesn't mean we don't, you know, get into the weeds and look at some of the details of these things as we do every week, you know, to review all of these things. And I appreciate Supervisor Madrone's getting into that in an analysis and seeking that feedback. But nonetheless, I mean, I have to have some trust in all of our departments to work together to basically, again, deliver services. That's what we're here to do. That's what I want to see happen. We're an organization, you know, you're right, as a, you know, $400 million budget or more, bigger than that. And all of that is, most of that is in the form of people delivering services to people. And I want to just stay focused on that. And so I you know, I think that this is a reasonable item that will get us to that place, even if some of the details maybe have caused some concern that I think has been addressed.
Thank you, Supervisor Wilson. Auditor Paz Dominguez, I see your picture on now. Did you want to make a comment?
Thank you very much, Chair Bass. And I'd like to say thank you to Scott Adair, too. It's been a pleasure to work with him and his team on this and other issues. We've been working together on getting the CARES grants out. So no complaints from me on that. I think he did a great job of recapping what my concerns were. I do, however, think there's some information that hasn't been considered yet. And that is that the function I serve is to make sure that internal controls are in place to protect this county. A weakness in internal controls is identified when contracts are signed but not authorized. A weakness is also identified when invoices are paid that do not have enough substantiation to justify the payment. Just yesterday, the CAO's office can confirm to you, we participated in an exit conference for a different audit of the propagation fund. And there were two findings proposed. One was that the backup was not adequate and did not substantiate the payment. And the second is that the descriptions were not adequate enough to provide clarity and appropriate reporting. In this situation, whether your board chooses to give advance payments is very much up to your board. Where I step in and where I have my concern is I'm being asked to issue a payment for services that are not corroborated with evidence. The invoices that we have paid already were not itemized, and we made exceptions as a consideration in the hopes that future invoices would have the level of detail that we asked for. For example, we are asked to pay for labor, but we are not told who worked, what day, how many hours, at what rate. We're just told pay 15 grand. Now we're being told to pay weekly $14,000 on a weekly basis ahead of services being provided for up to $1.4 million. This adds another layer of work for our office too, because in addition to issuing payments blindly up front, we'll then have to reconcile it at the end of a period. What happens if it's not reconciled? Are they going to pay the county back if they received too much money and didn't provide services? I have concerns related to internal controls over this whole situation. But I also, as a controller, I have concerns about giving direction to my staff that it's okay to approve payments for $14,000 without proof that any services were provided or will be provided. My opinions about other things are my opinions, but that's neither here nor there. That's where you come in with the policy choices. I'm here to represent the internal controls of the county.
All right, thank you. And Supervisor Wilson?
I guess that's what an advance is that that's what it is. It is a payment without an invoice. I assume. That's what I understand it to be, but I could be incorrect about that. And I would assume that there would be a reconciling that does occur. That is kind of the point about the post thing. But I do have to, when we do these things, we do have to ask ourselves, is it the value in terms of, because I can see why the auditor controller might ask or be concerned about having to look at something twice, I suppose, as opposed to just the invoice. It's all laid out, as opposed to an advance. Although I would assume that if it's contractually okay, it's just issuing the check based on the request and then going back and doing the reconciling. I don't know, maybe Alicia, you can help me out with this, but what say the CAO assistant?
Yes, the contracts explicitly lay out the exact dollar amount to be tendered each week. That amount won't fluctuate. We develop these amounts in collaboration with SMART in evaluating prior trends and establish the amounts to ensure that we weren't overshooting the monthly estimates. And then exactly as you said, Supervisor Wilson, there is a year-end settlement process that is worked up to that, and payment terms that indicate if overpaid, that SMART will refund any overpayments. And if underpaid, then the county will tender the remainder of the payments to SMART, all of which has to be done in a timely fashion upon the closing of the year. In addition to that, we've already collaborated with SMART to work in a month-end reconciliation process so that we can receive those details at the month end. So for the cash advance, the payments that are being submitted to the auditor controller are in compliance with the board approved, shall you ratify it today, agreement that dictates how much each payment is going to be each week.
And if I may, through the chair,
yes.
the auditor controller, this is not the only, that you're aware of advance payment. I assume if we were to do this, it's just not common. Is that where we're at, or?
I am not aware of my office issuing any payments in advance, and I am actually very interested in finding out who else we would be paying without having received any services. The only situation that I'm aware of where we pay, regardless of if a service is provided, is to the hotel that is currently housing COVID positive houseless people, I believe. That agreement was to just pay a standard flat fee, but the understanding is that those rooms are available. The difference with this invoice is there's no guarantee that there will be staff at the SMART level to provide those services. There's no guarantees. It's just give us the money so that we can maybe do it.
Well, and through the chair, if I may, it's not give the money. It's advance the money so that you bill later, and then we'll be, accountable to that. But yeah, I guess I could see where there's where there's some discomfort with relationship to that, but I guess, I don't know, maybe Alicia, can you address this issue with regards to there not being other advanced relationships within the county? And I'm a little concerned about us not knowing or there not being.
Yeah, I have a copy of the First Amendment, and I'm happy to send this off to the auditor controller to research what the billing mechanism was behind it. I am not sure. That would be a conversation to have with the DHHS fiscal staff. But the contract is First Amendment with Mental Health Organizational Service Provider, Redwood Community Services, Inc., for the time period beginning July 7th, 2020, to provide advance payments of $27,105 per month for the fiscal year of 1920. So again, that is in place. What transpired with that, Karen doesn't seem to be familiar with it, so I would suspect that it hadn't been raised as an issue, but that would be for the auditor controller to speak from her staff's perspective. But that is in place. And I would also like to point out that SMART is continuing to provide their services while we work through these weekly advance payments, and that the contract does provide council approved security for the county should SMART receive funding for services that are not legitimized after the fact, and the county would seek reimbursement on every one of those dollars.
And through the chair, and I'll end my inquiry at this moment, but with this, there's a question for Scott, for Director Adair, is he on here? Oh, there he is.
Yeah.
I'm just wondering, like, if this arrangement isn't done with this type of advancement, will we lose this contractor and these services, these important services that are being provided?
I think through the chair, if I may, in response to Supervisor Wilson, I have a response and then also a suggestion. I think the transparent and frank reason why we're here today is because the vendor is concerned about our ability to make timely payments. And because of that concern, because of perhaps previous experience, and I'm not laying blame, previous experience with slow payment on invoices, and their concern that they may not be able to provide services to our county because of that they wanted to see this new or different type of payment structure to give them assurance that they will continue to receive payment. That said, as we have been talking through this issue, and our office has explored potential solutions with county council, we've been engaged in communication with the auditor controller's office and also the CAO's office. We might be able to find a solution whereby we can go back and make some modifications to the contract if we need to, but continue to pay the vendor for now so that we don't lose these services. If we lose the vendor, we'll be in a position where we will have to issue an RFP and go back through the purchasing request for proposals process to find a new vendor to supply those services to the community, which would probably set us back a few months and would result in perhaps injury to the subrecipients who are receiving services from this particular vendor. I did talk to the vendor, and they agreed to actually bill 1 week in arrears, so that even though we're making advance payments that later they have to reconcile against, they're not really advance payments. It would be looked at as more as regular draws against the contract, and then they would bill or invoice 1 week in arrears. That way it's always invoicing for services which have already been rendered, but then we would have to do a monthly true up of all of those draws, and then there may be a final catch-up billing at the end of every month. The vendor is amicable to that. I think we're amicable to that. If the auditor controller is amicable to that, we can work with that as well. or other suggestions that the auditor controller may have. My only concern is just how can we retain the vendor through this transition as we work out a better way to handle the payments.
Okay, I'm going to actually go to Supervisor Bohn because I understand he is interested in talking and he just needs to push *6. And then after he's done, we'll go to the auditor and then Supervisor Wilson. Okay. Supervisor Bohn, *6. Okay, we're going to come back to Supervisor Bohn. Supervisor Wilson, auditor, sorry, I'm getting too like informal here. The auditor and then Supervisor Wilson and then Supervisor Madrone.
Thank you, Chair Bass, and it's okay if you let a Karen slip.
Okay.
Still right. I appreciate Scott Adair's efforts to find a common ground, and I like his one of the options he provided that they do weekly billing, but in arrears. So, and I heard him say that they've provided services. So we're no longer in a situation where we're even providing advance payments. They are now able to prove services were provided and we can resume payment, it sounds like. I would be, I believe he said the word is amenable. I would be amenable to providing and making every effort to provide weekly payments if we've received substantiation to show that services were provided. It's already challenging enough to be able to make such a commitment, but I believe we can reorganize our department and restructure our tasks to accommodate for that. I do still feel that I can't support the idea of paying weekly advances without substantiating documentation, especially because I also answer to auditors throughout the year as part of different program audits, and they do take issue with us issuing payments without substantiating documentation. And also, just so you know, I think we might start losing people because there are power outages going on across our county right now.
Thank you, Auditor Paz Dominguez. I'm going to give Supervisor, I have to ask Ryan, our tech guy here. Apparently, *6 is not unmuting Supervisor Bohn. Is there anything you can suggest?
There's, unfortunately with Zoom, there's nothing the host can do on his end to unmute someone. I can prompt to unmute, but the user actually has to unmute themselves. I know our staff is working feverishly. Kathy and Brooke are running around trying to do our best to get him on.
Well, he may also look at, if mute on his phone, because we all have a mute button on our phone too. So perhaps he could scroll through and find that. I'm sure our team will help him get on, but we'll keep checking with him. Supervisor Wilson?
I wanted to make some snide remark about Rex and a mute button, but I won't, even though I just did. All right. Because we do those sorts of things every once in a while. We let it slip. But, and Rex will understand. I really actually want Rex to be in this conversation, Supervisor Bohn, just because he is one of us, and he needs to be in this. And so whatever our staff can do to help him get into this space would be great. I guess what I'm hearing is that there is a modification that can be made that will ameliorate some of these things. The other option I was suggesting, and I don't know what the term for this current contract is right now. I mean, I just don't remember it. Can you remind me of what the current term is? Is it 12 months right now, or?
There's 5 different contracts associated to it, and each has a different term. One ends June 30 of 2022. Just flipping through them real quickly.
Well, it's okay. So what I'm asking, I guess, is could we modify you know, in terms of like just keeping services rolling as another option, which would be to do these advanced payments for, you know, for 3 months or some amount of time while we work out the systematic changes that need to happen in order to get things going, and that'll get trued up in the end. And yeah, I know it offers some discomfort for everybody all around, but at the same time, I want a practical way to make sure that that services are being delivered. Yeah, that's my main concern, and I appreciate the auditor controller's concerns with relationship to, you know, the books and how the necessity to make sure that things are aligning. So, you know, and this is that give and take in that space. And so, would that be possible? Could we amend these so that the proposed advancements extend for 3 months during such time as everything gets arranged, or, you know, transfer into the more traditional way of dealing with these things if an arrangements come to pass earlier than that. Is this a possible arrangement that we could do so that we could kind of get past this, keep services rolling, and make sure everyone's happy?
Supervisor Wilson, do you mind, before we get the answer from staff? I ended up calling Supervisor Bohn on a phone, so hopefully we can hear him. So I do want to give him an opportunity to weigh in at this point. So, all right, let's see if this works. Go ahead, Rex.
I like technology. I'm on my third.
Okay.
Anyway.
Can anyone hear him?
Through Scott Adair. Okay. Scott, the Smart Services provides these services to how many other counties, and do they all have the same issues? I mean, they provide them to quite a few other counties, don't they?
To the chair, in response to Supervisor Bohn, SMART has been around as an organization providing services since 1979. They do provide services to NORTEC, which is a consortium of other counties on our border who administer workforce programs to subrecipients in those communities. So they do provide services to multiple other counties. I'm not aware, they did not share with us that they've had any payment issues with other jurisdictions or what those would be. They did share with us that NORTEC through the state has a nearly similar payment schedule in which they give weekly draws or payments for services, which allows them to expedite payment to SMART. And that is in part one reason why we used that for our agreement, was to model off of something that was already occurring between NORTEC and the state.
All right. I see Alicia was going to say something, and Supervisor Wilson, but Supervisor Bohn, did you have more to add to that, or do you just want to? No?
I just for the heck of it, to move this on, I'd love to recommend staff's recommendation, but I'll make that a motion.
Okay, we have a motion for staff recommendation. Is there a second at this time?
Thank you.
What? No, I think when Supervisor Bushnell, were you going to second?
So to clarify, the motion is to move forward as amended or not? I'm sorry.
His motion, I believe, was staff recommendation, which is not amended. So perhaps we can ask.
I am going to second that.
Okay, so, and that's fine, because we can certainly move that and change it along as we go. So at the moment we do, and we are running up against our 1:30 time set, but that's not unusual. All right, Alicia, I think you wanted to respond to a question, and then we have Supervisor Madrone and then Wilson.
Oh, yeah, I just wanted to respond to Supervisor Wilson's question on whether or not we could dictate a term. These contract amendments are completely at your board's will and is a policy decision. So you have the capabilities to navigate and direct staff, whatever your board feels is the best interest of the county moving forward. And staff is happy to implement that.
I appreciate that. And I was kind of wondering, going back to what Scott had proposed, and I guess I don't fully grasp that. I just want to note that this organization does work for Delaware County, Humboldt County, Shasta County, Siskiyou County, and Trinity County, among others. So Scott, can you just one more time outline what your proposed, if not suggested, modification would be?
My suggested modification to the recommendation would be, so long as the auditor controller is also amenable to it, that staff work with the vendor over the period of the next, we could call it 90 days, to make a modification to those amended agreements which were brought before your board today, and then we would have to bring those back before your board. But that until that modification is made to improve or correct the payment structure, so that that payment structure is one which is acceptable by all the parties, that the Auditor Controller's Office would agree to continue to make payments to that vendor so that we do not lose services, so long as that vendor is willing to continue to bill weekly for services already rendered, and that the vendor provide the itemized invoicing for those services.
I mean, if the vendor is okay with that and the auditor controller is okay with that, and we're still continuing services, I don't know, it won't bother. I mean, I just want to continue services. That's my main concern, So as you know, I'm not an absolutist in these formats. So
Virginia, do you have Rex on the line still through the chair?
Well, he hung up on me, I think.
So I'm trying to see if we can amend.
Okay, let me find him.
He's back on Zoom. I'm bringing him back into the meeting right now.
Okay, first then, while we're doing that, before Michelle amends, I did want to go to Supervisor Madrone because he's been patient.
Thank you, Madam Chair, managing a bunch of Hollywood squares here. So I like where this conversation is going. I can't support the motion that's on the table at this point, but I could support the amended motion that would basically be what Scott Adair just laid out. I think that serves all parties. I'm very concerned about increasing workloads for everybody. And so if the invoices we're paying are 1 week in arrears, in other words, they do the work and that next Monday they bill for that last week, then the auditor controller is not having to do the work twice, right? Because we're not paying advances. So it really streamlines things. I appreciate your work, Scott, and Ms. Dominguez, in terms of the effort here to try and find a compromise to keep this working. I could very much support that motion. I was intending to make it myself, but I didn't get in quick enough. Let me also say that advances very much concern me. I think that we ought to be able to provide those in appropriate situations. But in this one in particular, I think it's really just, it was offered up as a way to somehow try and deal with these late payments. But I think we're dealing with that with Scott's proposal. If the vendor submits the appropriate itemized details as asked by the AC, then those payments are going to be made promptly. That's what I heard the auditor controller say, that she would commit to staffing that to make that happen on a regular basis. That solves all of it without us getting into the precedent setting issue of advances. And I recognize we've done a couple of those in the past. But frankly, there is a huge amount of interest in our community from our vendors in getting advances. If this is going to be something we're doing and setting that precedent, I mean, the Neyland Fire Department was a great example. I know for a fact that Orleans, when they got the Measure Z funding, they were like, gosh, how are we going to do that? We don't have this money to buy the materials in advance, but we got to pay the bills. So there are many volunteer fire departments that would like to have advances. There are many people in the Trellis program that might like to have advances. There certainly are lots of watershed groups that are doing an amazing amount of public interest work in salmon restoration and flooding protection that would absolutely like to have that. But the way that all these groups deal with these things is they use their general fund. It is true that you can't take money from one grant that was for specific line items and use that to pay another grant. But after you get your payments on your grant, a certain amount of that typically goes into your unrestricted or your general fund. And most groups then use, I'm almost done.
No, I think you've got, I think you may have a motion coming towards that will actually satisfy your concerns. That's all. I understand.
I agree.
Okay, go ahead.
I agree, and I'm almost done. I just wanted to point out that, that's why people get lines of credit. And this group is absolutely in the position to have a line of credit. I'm sure they do. And that's what we do. Now, their fear is that they might not get paid for many, many months or something's going on. So they just need to do a better job of detailing their invoices, make it 1 week in arrears, and I could absolutely support that amended motion. Thank you, Madam Chair.
If it's amended. Supervisor Bushnell?
Supervisor Bohn, I would like to amend it, but it was your motion. Can I do that?
I'll pull my amendment. Go ahead.
Okay,
I'll pull my motion.
Okay, so that we can move along and that everybody can be satisfied. Scott, are you there?
Yep, there he is.
I'm still here.
Ryan, are you listening? Because I'm going to ask Scott to repeat that so that we can get this, so that I can make a motion.
Yes, and Scott, if you could speak up a little bit, it's very hard to hear you.
I apologize. My face is going to have to get really close. I'm sorry. But I'm certainly happy to reiterate that. I probably won't be able to say it the exact same way, but I think it would be probably more efficient to first ask if the auditor controller is even, if that's acceptable to the auditor controller before I restate.
And I was going to ask for your suggestion and then ask Ms. Paz-Dominguez if that's acceptable in just trying to move everything forward.
Okay, then I'll restate it so then you can ask Ms. Paz-Dominguez that. So my suggestion is that staff go back and work with the vendor to modify the payment structure in the contract to reflect what has been discussed here today, to allow for weekly payments for services already rendered, not advances, and that the vendor would also provide itemized invoicing for those services rendered, and that the auditor controller's office would continue, and we could put a 90-day cap on this, would continue to make payments to the vendor so that we don't lose those services, so long as those payments are for invoices remitted weekly for services already rendered and which are accompanied by itemized invoicing. And then that way we can continue to pay for those services, retain those services, and then staff will bring back the modified contracts back to your board for approval within 90 days.
Okay. I want to ask, thank you, Scott. So equally, I would like to ask Ms. Paz-Dominguez and Alicia if that is, do you think that's doable? Through the chair.
Thank you.
Yes, Ms. Dominguez.
Thank you, Supervisor Bushnell. I think Scott has presented a great idea. I am fully supportive of it. We are very amenable and we'll even set reminders on a weekly basis to make sure we don't miss any of them.
Thank you for that. Through the chair, Alicia, and that's gonna, so we,
yeah,
so I'm gonna,
I likewise agree that we are happy to effectuate that motion and amend the payment terms to accommodate all parties.
Okay, so that's going to be my motion, and thank you.
I'll second it.
Okay, we've got a motion that's been seconded by Supervisor Wilson. I'm not seeing any hands up of anyone else who wants to comment on this. at this time from our board? So Ryan, will you do a roll call vote, please?
Yeah, and just one clarifying question. So are we not approving any of these staff recommendations here? It's just purely what Scott stated?
I believe that, yeah, because I don't think we're gonna, unless we want to get payment. So this is what we're gonna have to do to go forward. Am I correct? Yeah, yes, Ryan, that is correct.
Okay, thank you very much. Chair, I'm ready to take the roll call if you are.
Supervisor Wilson apparently has one more thing to say.
I just want to, again, and reiterate that governance is messy sometimes. It takes time to deal with some of these issues, but I want to remind everybody our jobs, and as we all know, and you guys all know, and thank everybody, is to provide services. And I think that's foremost on everybody's mind. And I'm glad we're getting to a conclusion on this item, but just, and we are working really hard and we're all stressed and we all are in the COVID mode of no vacations and go, go, go and constant. And so I want to thank everybody and empathy to all of our staff in the CAO's office, in the Auditor Controller's office, in the Public Works Department, and the HHS, and every other department that we have. Let's just keep them rolling. I just want to thank everybody for their work.
All right, and I think we'd all say ditto to that. So, Ryan.
Thank you, Chair. Supervisor Wilson?
Did you say yes? You froze.
Did I freeze?
Yeah.
Yeah.
Thank you. Supervisor Madrone?
Yes.
Thank you. Supervisor Bushnell?
Yes.
Supervisor Bass?
Yes.
And Supervisor Bohn?
Yeah, but I just very reluctantly, I don't know why we have staff if we don't listen to their recommendations. I'm sorry. But thank you for everything you do.
And I want to thank our staff too, Alicia and Scott. And thank you, Ms. Paz-Dominguez, for
and the
Sure,
other.
I just want to clarify something because I'm learning about communication and I realized that I just did something that has two different meanings and I want to make sure I didn't offend anybody. So when Mike Wilson said something, I was trying to show him that I agree and I went like this, like snaps.
I saw it.
But I then realized this also means like hurry up. And I'm so sorry.
No,
I did not mean that.
Actually, it's a good idea, though. Nice reminder.
We could hurry up, too. It's okay.
All right. So that is the end of this item, right? We voted. We're good. All right.
Thank you, everyone.
So, yes, thank you, everyone. And I really was trying to give us a lunch, but we have a closed session at 1:30 that I know is one we need to actually deal with at 1:30. So we don't have a bunch of people waiting on the line. So I hope you guys are all fine with that. But I'm wondering, Jefferson, can you just read all the closed session items since we won't be coming back into open session necessarily for discussion?
Yes, Chair, that was going to be my suggestion as well. It's the intention of the board to meet in closed session on 5 items. The first is to discuss threatened litigation pursuant to Government Code 54956.9D2 related to overtime pay and the impact of the decision in Flores versus City of San Gabriel. The second is a conference with labor negotiator pursuant to Government Code 54957.6. The intention of the board to meet in closed session to review the county's position and instruct its designated labor negotiators for the various labor groups that are listed in the agenda. The last 3 items are all conferences with legal counsel to discuss existing litigation pursuant to Government Code section 54956.9D1. The first is the case of Gamariello versus Moore, case number 520CV2583. The second is Ken's Water Tender versus County of Humboldt, case number DR170672. And the last is Silverman versus Dwayne Christian et al., case number 520CV05136 BLF.
All right, thank you, Jefferson. We do have one person for public comment, and that would be Kent. Welcome, Kent.
Thank you for my opportunity to speak on your closed session. As I'm doing this, I have a great concern that the public only sees one of you at a time speaking, and we should have all of you on the dashboard at the whole time so we can tell whether you have a quorum or who's doing what. I believe that may be mandatory. You may wish to check with your counsel. So do you want a closed session regarding that particular topic? I did want to say, and I've had some communication with some people who are kind of in the know regarding your employees, and you have those people going to session. I think if I were them, it would be bothersome for me to be a management in your position and having attorneys always coming up against those people. That's not a warm and fuzzy thing. I think you're best to do this in-house, to find someone qualified, either staff or the head of HR. And that's just a perception as far as being friendly. Now, regarding specific groups there, my understanding is that such groups as the people with the health department, and I could be corrected if I'm wrong, who actually deal with the hazmat thing, the COVID testing, or if you had ricin or something in there, are making just about minimum wage, a little above it, and that concerns me. Also, such things as negotiating with your people who work for, I believe, Tom Madsen, and they have a certain amount of tool allowance, which may go back 20 years or something. It sounded very small to me, but for anybody who's in construction, when you're negotiating things, I highly recommend you increase that. If you have know anything about construction, it's having the right tool, having it in hand, not having to go out and get one, not having to borrow one, and that kind of investment in your workforce will pay for itself, if not 100 times, or 10 times over, 100 times over. I can guarantee you to have the best tools in their hand that you can, and the allowances for them to pick the tools that work best for them is the best way to do it. So I highly encourage you to start looking after all the little people out there. A high, significant portion of these people, are not that much above your minimum wage rate. And yet I spoke out a little sooner today when one particular group was getting $6,750 per person. So thank you for your opportunity to speak. Have a great time. And when are you going to report out? Are there any other topics other than just a closed session, or where are we out on the agenda?
Thank you, Kent. The closed sessions are all we have left on the agenda. So, Jefferson, do you have an estimated time that we might make it back here, as long as we built? Oops, sorry, done.
I would have an estimate of 60 to 90 minutes, but the board may want to take a break within the closed session time period to eat something, I imagine.
Yeah.
So we may want to say 2 hours.
I'll say, 2 hours sounds reasonable. And Supervisor Wilson, did you want to say something? I saw you bouncing around. No? Okay. So what I would suggest, we take like at least a 5-minute restroom break. So, because I've been drinking lots of stuff. But before we do, I've asked to adjourn in the memory of someone today, and so I want to do it now. Ann Stewart, some of you may not know her, but she was very involved with city politics for a very long time. Her husband, Cliff, was on Eureka City Council, and she just really poured herself into it. And I remember she was the mystery voice that called me the day back when I was running for city council, because the other guy backed out. And anyway, she was really personally involved, kind of a very strong woman, but a heart of gold. So that's very sad for her family, her son, Thomas, that she passed. But I did want to recognize her today, because she's someone who actually had a lot of influence over the years, or a lot of, I've had a lot of contact with. So thank you for indulging me in this. So when we come back, that's who we will adjourn in memory of. And so having said that, how about we 1:55? Or should I just make it to, wait, we gotta, okay, 5 minutes, because we don't want to have the attorneys waiting. So be back in 5 on the other Zoom.
Dear Chair, on items K2, K3, and L1 and L2, there's no reportable action. On item L3, the board voted 4 4-0 to authorize the risk manager to sign an amendment to the contract with Porter Scott to add the defense of this matter.
All right, thank you very much. And with that, we will adjourn in memory of Ann Stewart. We're officially adjourned.